How long do y'all have left in special topics? A week and a half? Okay, wow, so very exciting. Y'all are about to be off to the next thing. What? Indeed. Okay, sweet. Hey, I'm Amy. I'm a physical therapist and an alum of this program. I graduated in 2020. Can I get a hand up if you heard me talk last week? A bunch of y'all were there. Okay, cool. So just a couple of new faces. Awesome. Okay, so last week I didn't get to talk about what I get most excited about, which is the actual physical therapy, like clinical side of things. This is the first time I've given this presentation. In years past, I've given a presentation on low back pain and on a like specific treatment sort of like model for that. That is not my own model, somebody else's model. After a few years, or after like 5 years of giving that presentation, because I gave it for the first time actually a month before I graduated, I decided that like that wasn't the most representative of like who I am as a physical therapist, and also not the most representative of like what is actually going on in my clinic and what I would like to be told if I were like in your shoes getting ready to go out on clinicals and then go out into the world as a physical therapist. So instead, I developed this presentation over the last little bit that is insanely broad, but it is what my specialty is. It is working with endurance athletes from the pain side of things all the way out to like the performance side of things. So if it sounds like I haven't given this presentation before, it's because I haven't. So cut me a little bit of slack if I do not seem super duper smooth. The other thing about this presentation is that I didn't know exactly how long it was going to take, just because I don't know. I've got like some breaks for us to practice some things. I don't know how long we'll take on certain like manual techniques and certain exercise stuff. So, you know, I'm going to give you a lot of good information. I've linked a ton of exercises in this presentation. I've got like YouTube links of mostly like our YouTube. There's a couple other people scattered in there as well. But if we don't get to everything, I stand behind everything that that is like in this presentation that I'm going to show you. We actually have, I looked yesterday, 1,100 videos just on our YouTube, because anytime we give a client an exercise, we like try to follow that up with an actual video so that, you know, the person does what we want, you know, to the kind of specifications that we want. So this is also not meant to make you like a competent endurance athlete, physical therapist, like in this moment, but it's a really good starting point and has a lot of really good context on like what I think that people need to consider, because I think people get like too down like one rabbit hole like really easily, especially as you're coming out of school. And that's certainly what happened to me. And I want to present you like you need to be able to draw from a bunch of different things that I'm about to tell you about to do a really good job for these people. Okay, this is my company. I co-own a practice with 6 physical therapists, myself included, called East Side Movement Company. We're on the East Side in Austin. Yeah, it's great. I started in 2020, right out of school. Here's some pictures of mostly recent history of what's going on. The picture of me at my dining room table graduating is me graduating during COVID with my mom behind me. It was really anticlimactic graduating from your dining room table, but whatever. My sister's next to me. She's also a Texas State PT alum. She was 2022. She works for like performance physical therapy practice in Houston and also works with a lot of pretty sporty folks. In the middle, this is my team. This is Anthony, my business partner. This is Spencer, Aaron, Zivi, and Emily, all really great people. This is the little corner of our clinic that is our gym space right now. We're getting ready to move into a really big space that's going to have like, it's going to be 3 times as big as our current space and have a lot more room for strength training. And you'll find out why I think that's so important in a moment. You probably already know. Here's some other stuff. We ride bikes. Sometimes I go to a run club and run, and then, you know, eval people or do like mini injury consults right afterward. That's what's happening in both of these. That was a run club. This is a bike club. So this is like, and this next slide will show you as well. This is my bread and butter and like what I'm most interested in terms of movement. I do a lot of strength training as well, but when it comes to running, trail running, biking, hiking, endurance sport has been something that I've been deeply involved with for a long time now. I grew up as a swimmer. Swimming's not a very social sport, so I am not really a swimmer in adulthood unless I'm like training for a triathlon, which happens every so often. But yeah, this is a picture of like endurance sport. Endurance sport is like really big in general, but like super big in Austin right now. It is the thing that everybody wants to do. I'm sure y'all have heard about run clubs and have probably been to some. The picture, I kind of wanted to show y'all too, like how big of a deal this is. This is a picture of like what it looks like at Breakfast Club. Breakfast Club is a cycling club that rides once per month. Diego has been out there at least a few times to it, but it like people are flocking to an endurance sport in like a crazy way because like 1,000 people will show up to ride their bikes with other people on like a Saturday in Austin. So it's a great niche to be into if you like one of those sports. I was most into cycling initially and have kind of expanded out into the other things after swimming at least. Okay, the other thing, I'm here to challenge you today. If I felt like what you learned in school was good enough to make you like pretty good at treating runners and cyclists and other endurance athletes right out of school, I like wouldn't feel a need to do this presentation. So if your brain feels kind of like scrambling, like you absorbed a lot of information, did a lot of things at the end of this, good. We need some challenge to actually like grow, right? So there's that. Here's a picture of me and Anthony presenting to a business group that we were previously a part of last year. And I put this up here just to like show you guys that like we have gotten a ton of traction at Eastside with like this specific population, so much so that besides filling mine and Anthony's schedules, we've managed to fill like 4 other PT schedules. So I really do think I know what I am talking about. The other thing that makes me think I know what I'm talking about is that I've dumped like tons of money and tons of time into learning a bunch of different things while I was in school and like after school. I've taken a ton of online like weekend courses. I've taken a ton of in-person courses. I've done mentorships. I've like been down so many like podcasts and YouTube rabbit holes, and like what I've kind of integrated in the past like 6 years that I've been a like full-on physical therapist is like all of these people from their own little methodologies will like you'll go to their weekend course and they'll tell you like, okay, if you just adopt this and if you just get really good at this one thing, you're going to be awesome at treating like 85-90% of people who like come through the door. But the problem is that like there's not enough people doing like a really broad approach to all of the different things that you need to be like really awesome at working with people. And like obviously I'm going to talk mostly about endurance athletes, but what I'm talking about, like, you know, drifts down to like working with athletic people in general, as well as just like the regular population as well, especially like folks who are a little bit more engaged with physical therapy and willing to really engage with you on exercise. So kind of my origin story was I got really into the Postural Restoration Institute while I was still in school. They do a lot of like low-level nervous system downregulation, like breathing exercises essentially. But the reason I got so into that was that while I was in school, you know, like all the hype was around like strength training. I should be strength training. Everybody should be strength training. So as I was trying to get into strength training substantially, really for the first time in my life, I tried to deadlift too much weight, like way too fast, and I gave myself a disc injury. You know, so the other thing that didn't help was that around the time right before I gave myself a disc injury, we were learning all of the like lumbar spine manips, and my back like really didn't enjoy it. Like all of my classmates just like yanking on me all the time. So I found myself a physical therapist who got hurt during PT school, or an SPT who got hurt during PT school and couldn't help herself with the stuff that we were learning in school. And that was incredibly frustrating, and maybe an experience that some of you have had, because I imagine that most of you would have some sort of injury. And maybe you were hoping that the stuff that you would learn in school would take care of it, and maybe it has, but maybe it also like hasn't done what you thought that it was going to do yet. That drove me into a place of a lot of like existentialism and like questioning. But eventually, the reason why I got so into PRI is a totally biased reason, is that it was the first thing that like really helped my low back pain without there being like essentially like somebody at the level of one of your professors doing a very specific manipulation on my lumbar spine. It gave me something I could do with my own body that like helped me when my back was flared up from like something random, essentially. So the other thing I really liked about PRI, and that I still like about PRI, is that they look at the body not as just like a bunch of muscles all separate. They acknowledge that there's like fascial chains and like muscle chains that are linked throughout our body kind of from head to toe. And that was something that like was briefly mentioned in PT school, but we really didn't talk about. So this concept of like choosing exercises that help with more than just one muscle just like made sense to my brain from a mechanical standpoint. So I really vibed with that. I also I liked that it involved breathing because I was hoping to learn more about breathing in PT school, and we really didn't get much besides like tell your patients to take some diaphragmatic breaths, which just means some like belly breathing breaths, because that's good. And it was like, that was the depth that we got. And I was pretty annoyed with that. PRI goes a lot more into breathing. I've spent a lot of time with PRI to the point where it's like, it is a helpful like first step. I've essentially put it in one of these like buckets that I'm going to tell you about. My practice had a huge ceiling on it, and my results with people had a huge ceiling on it because I over relied on like one thing to like help people out essentially. And I kept trying to put square pegs in round holes essentially. So it is part of what I do. It is not the whole thing. And I'm going to talk to you a little bit more about some other things that I do think are worth your time and attention. But the whole point of doing all of this was that I wanted to make myself better as a like physical therapist, but then it turned to like, how can I make it to where like the people who are on our team and the people that like I'm mentoring don't have to spend like 5 years in the trenches struggling to like figure all of this stuff out and piece all of this together? How can I accelerate that? And obviously there's a lot to learn when you're like out on clinicals and becoming a PT, but like, how can I help somebody be a good physical therapist in like 6 months or a year instead of like the months that it, or the years that it took for me to kind of wade through all of this? So Anthony and I have done a lot to like distill down what the best parts of each of these things are. And that's part of what I'm going to be talking to y'all about. I also don't know everything. People, if like it were easy to take care of people and to like help with knee pain and back pain and foot pain and all of that stuff, I wouldn't have a job, right? Like you wouldn't be in school for this. It's like if there were a meta-analysis that said how you treat anterior knee pain, I wouldn't see any anterior knee pain, right? Like ChatGPT would tell people what to do and it'd be done. So I don't know everything. I learn new stuff through my own body and through the clients that I'm working with literally all the time. But I think I can give you a pretty good running head start. And I think I've got a lot of things figured out versus where I was 6 years ago. The other thing that like is flashy and interesting in kind of like this world, in our world, is this, what I call party tricks, essentially. And there's a lot of things that are like neurologic party tricks. And what I mean by a neurologic party trick is something that like in the blink of an eye. So like manipulation is a really good example of this. So if you manipulate somebody's T-spine, a bunch of things like get better, right? If you were to check their shoulder internal rotation, it would most likely be improved. If you were to check their straight leg raise, it would most likely be improved. We know that like if you give the body certain like nervous system inputs, it helps calm things down. And that's like awesome for buy-in. It's super compelling and interesting and attention grabbing for both you and like the people that you're treating. But there's a difference between like a neurologic party trick that like helps like maybe boost somebody out of pain for a moment, and the things that help like essentially keep sustained change around, and sustained change being things that drive down pain, improve function, and help somebody actually like move forward. So a lot of conventional PT, at least in like my experience, because of the constraints that like insurance and in-network settings sometimes put around people, you have to rely on things that are like a little bit more on the party trick side of things. And if you're lucky, you get to start to work on some of the sustained like change type of things, but you don't fully get to get into that. And I think it's also helpful to like have in your mind, like, is this a party trick that's going to help kick me off and help this person move forward? And like if it is, that's great. We can still use those. Those are awesome. They're super helpful. But like, what am I also doing that's going to promote like actual sustained change that like correlates with actual function changing? So like running, walking, standing, like doing all of the other, biking, doing daily activities, like sitting at your desk, like for your job without your back like killing you. Like all of those things matter a ton. And you want to make sure you get to exercise that is like profound enough that it has like carryover effects into like the rest of somebody's life for like months after like they've seen you, instead of just, you know, a couple weeks. There's also, I also really had to struggle with like coming out of school and moving forward, this concept of like dependence when you're in school, because of just like the way that things are. It's really kind of beat into you that like your job is to like efficiently get somebody out of pain, back to function, move them forward without creating dependence, and to discharge them like essentially as quickly as you can, right? Because ultimately like that's what the insurance company wants. What is true and what I have learned through like my own body, through again like a lot of clients, through like taking care of like helping Anthony take care of his body in the like PT way, is that like there's a difference between getting somebody to be dependent on you and like accompanying them through like different phases of their life, and through like especially for these endurance athletes, different training cycles, right? So when like training volume jumps up, it's not surprising if like the weak link in the chain makes itself known and somebody's knee starts to hurt, their foot starts to hurt. What is helpful is them already having a relationship with a PT who knows about their body and knows about their patterns and says, hey, come on in, let's take care of this before it becomes a big, bad, ugly thing. Let's make sure that we don't have to disrupt your training volume. And let's sort of like walk you through that. So I do a ton to help empower my clients, to give them the tools that they need to like make good decisions and to weigh essentially risk. I talk a lot about like risk management with my people because it's like people are always, a lot of endurance athletes are always going to want to like push it a little bit more because they've got like this thing in them that says like run far or fast, bike far or fast, like push yourself, like do more. And for a lot of people, the thing that like stops them from doing more is their own body. And the question is it going to be musculoskeletally or neuromusculoskeletally something, or is it going to be their lungs? Because like one of those things is going to put the brakes on people as they're trying to like keep up with their friends and do all of the other like fun stuff that they enjoy. So I'm not really in the business of just like seeing somebody for like 5 visits or like, you know, a few visits and being like, okay, like I've taught you all that, you know, you can be taught, like we're all good. You know, a performance physical therapist who's got these tools that I'm going to talk to you about has the ability to like accompany somebody through training cycles and through life in a like longer essentially way versus what maybe conventional PT would tell you. Okay, these are the buckets that I think are super important. I spend a lot of time thinking about how do I distill down like what I think are the most important things. A lot of people only get good at like 2 or 3 of these. And I think that all 5 are important. And I think that like PTs who dismiss like one of these buckets, I don't know, just like aren't willing to kind of like stretch their brain and kind of like push themselves and think about things. So manual therapy, you guys obviously know what that is. At Texas State, at least while I was here, did a like really good job with manual therapy, or at least like one side of that. Neuromuscular and motor control education is the next box. That is like, it's maybe the like broadest category on here because it is like any PT kind of related exercise that is like a nervous system calm down exercise, a brain body reconnection exercise, a like muscle chain connection exercise. I'll tell you more about all of those, but like a lot of PT is this, at least in sort of like conventional world. And I'm like picky about this box in particular because it's a really good bridge to help people get to strength training and to successfully like stay engaged with strength training. I think that like this also gives you the capacity to work on like asymmetries and other things that are off, sometimes in a more profound way than strength training, other times depending on the person, strength training does a good job too. And I'm presenting these like they're distinct buckets. There's quite a bit of overlap between these two, right? Like this is brainy exercise, this is more like output, like move your body type of exercise, essentially. Plyometrics, hopping, jumping, sprinting, throwing, all of that stuff, like dynamic power production and absorption, also really important for this population. And education is also obviously really big because people are always going to want to know, when can I run? How far can I run? How fast can I ride my bike? Is it okay if I do this? And like, as an endurance athlete PT, you have to help people make good decisions on like what their next like week should look like or what their like training plan should look like. Because if you're not helping people manage that, you're missing like a big part of the job. Okay, so at Eastside, we came up with like words to help people understand like which stage of rehab that they're in. I showed y'all this the last time, or showed y'all a similar thing to this last time for those of you who were there. Eastside has essentially like 3 phases that we talk to people about to help them understand like where they're at in their like physical therapy journey, because we think it's important that people get like as far along down this path as often as we can get them to go down the path, right? So the reset phase it's like pain is our big motivator, and we're trying to do things that are going to calm things down, decrease pain, start to kick things off. Restore is more based around helping resolve like root causes. It's essentially like a step up in exercises. Reset phase also has a lot of manual therapy. The restore phase would have, for the average person, less manual therapy. Fortify is all about like increasing strength and resilience to future injury. So it is strength training, plyos, things like that. Not everybody makes it all the way to the end, depending on exactly what's going on. A lot of times people bounce around between these phases. You know, in a typical PT world, you would think that they would start here, go all the way up, and then, you know, that would be it. They don't need your help anymore. You've helped them, you've given them the tools, it's all done. But like the reality for an endurance athlete is that like we're going to bounce around between these tools depending on like what's going on. And it's important for us to talk about Fortify, to get people in the strength training world. Some people like aren't going to make time for it. Unfortunately, I'm trying to like help solve for that problem right now. And that like in our new space that we're going to move into, we'll have room to do small group training, because a lot of endurance athletes like are either intimidated by the gym, or going to the gym isn't fun, or like they like maybe have like a 5-pound weight at home, but a 5-pound weight really isn't heavy enough to get them the like adaptations they actually need. So part of like me and us, like the team at Eastside, figuring out like how do we help empower people to actually get this done, is like hosting small group training classes at our location or at our facility, where like people can be in community, because a lot of times these like endurance athletes like to work out with other people as well, and need a little bit of extra external motivation to get things done. These are the graphics that we had a designer come up with to represent those phases. And then this is in general where I would put like how much we use each bucket for like each thing. So manual therapy is really reset. Neuromuscular and motor control is reset and restore. Strength training is restore and fortify. Plyos are restore and fortify. Education happens at all of the stages, because it's really important to help people understand what is going on in their bodies. Okay, I talked about this already. Taking care of an athlete is not linear. People are going to go back and forth. We also talked about the next thing already, is the goal ASAP discharge, only if it's the person's goal, right? If someone's like, hey, Amy, I really want to work with y'all. I've heard such great things. I'm really excited. I don't have the money or the time or the whatever it is to work with you for forever. I have like this much sort of resource. This is what I'm thinking, you know, does that line up with this problem that I have? Do you think you can help? And if the answer is yes, and somebody doesn't have the means to like work with us for an extended period of time, absolutely, I take that into account, or we take that into account when we're planning for folks. But in general, the answer is ASAP discharge is probably not the case. Okay, so again, ultimately the biggest thing is like, what is the goal of the person in front of you, and then you helping be realistic with like what it is actually going to take to move them from where they are now to where they want to be. So if the person in front of you says, hey, I want to be able to run a 5K, and I want to be able to run a 5K like 6 months from now, and I haven't really been a runner before, and as I've tried to get into it, my knee bothers me, but I've been able to run about a mile before my knee starts hurting. That's not a huge gap between like I've been able to run a mile, I've had some knee pain, it's only with running, and like I want to be able to run a 5K, I don't need to run it tomorrow, it's down the road. That's someone who I'm like, okay, sweet, that's super reasonable. I can definitely build you up to that. We can definitely kind of problem solve through things. The conversation that I would have with that type of person is different than somebody else who's like, hey, I'm a high level runner. I've been running for a long time. I've been running through hip pain for a big chunk of the time that I've been a runner. My hip sometimes like really bothers me. It maybe gets to like a 7 out of 10. It's sometimes pretty sharp. I don't care. I've always just kind of pushed through it. I have a high pain tolerance. I'm running a marathon in 2 months, and I want to PR it. I want to run faster than I have before. A very different conversation with that person versus the person who's like a more casual, like, hey, I just want to like do a 5K and kind of like dip my toes in. So helping somebody understand like the distance between them and their goals is really important, so that you can do a good job of like helping them sort of like go along with the plan, and helping like build an actual plan that's going to like help move the person toward their goals. Sometimes, a lot of time, like, so Austin has its marathons, or like half marathon, and then like the half and the full in January and in February. So this is a conversation that we have a lot with people in like December or in January, where people are like, hey, I have the race, I'm signed up for it. My knee hurts, I don't know what to do. I don't know if I should still run this race. I'm looking for you to like help me decide if I should still run the race. So you need to be able to gather information and kind of piece things together to like help this person understand how much risk it is to like choose to run this or not, and like if there's enough lead up time for us to feel good about them doing this, versus if it's going to be like a, ooh, if this is really important to you, you can totally do it. it might set you back a little bit in trying to like help people kind of grasp the reality. Okay, what's going to help you understand at least part of what's going on? Kicking things off is the evaluation. It's probably obvious that I could spend like a whole 4 hours talking about like any one of these things that we're bringing up. We could spend like a long time just debriefing the eval. I've given you some high level stuff that I think that you need to know that I didn't get in school or had to learn later. Overall, I thought Texas State did a pretty good job with like organization and structure of evals. Typically when people come through our clinic to interview, like Texas State students or Texas State grads are like relatively organized with what's going on. I think that because of just the way that that school is, people get really bogged down on like a tissue diagnosis. So it's like you want to know exactly what tissue in the knee is like generating pain, right? Like I do too. That's a really natural thing. Your client does too. But the problem with that is that just knowing what tissue is irritated doesn't really tell you like all of the other cascade of things that overloaded that tissue in the first place. And like if you are not taking an image and MRIs don't and x-rays don't catch everything, it can be tough to like exactly diagnose like tissue, and it doesn't ultimately matter that much. Clients are going to come in and patients are going to come in and they're going to want to say like, I want to know what's going on. Like, do I have IT band syndrome? Do I have runner's knee? Do I have whatever? I try to like pull people away from identifying too strongly with like something that they can Google. If it's appropriate, then like, sure. But like, I don't need somebody to be like, I have like a syndrome. Like I've got like IT band syndrome, and it's really just like, hey, like the muscles that attach to your IT band and the ones that are around it are holding too much tension and kind of like overloading this tissue. Like we don't, if it's been going on for a long time, it can feel good to like identify with something, but it's like, we don't need to like identify with like runner's knee or like IT band syndrome or like any of these other words. We just need to identify with like the reality of what's going on in your body and get a plan to like move forward. So I'm really big on trying to help people understand what the global patterns are that are contributing to what's going on. Case example number 1, runner with hip pain. The client comes in and says, the side of my right hip hurts, and like this person hasn't had imaging. And in a lot of cases, obviously you guys know, we don't need imaging. Really, we don't need imaging unless we're worried about big, bad, scary things. And especially if those big, bad, scary things might result in surgery down the line is when we start to become a little bit more concerned with that. But it can be tempting to like want to tell somebody to go get imaging so that right? And so that they know, and that can be really exciting. But we also know that like getting imaging too early can like actually negatively affect people, right? So, and that physical therapy and conservative management can really go a long way. So, if a runner comes in with hip pain and the side of their right hip hurts, if I think it lines up with like your labrum's irritated, your glute med's irritated, the whatever it is irritated, I will tell some people about, or I'll tell people like, hey, you're acting like X, Y, or Z is irritated. And I tend to focus on orienting them towards things that we can change quickly. So unless somebody is a screaming labral case and like they've already used the word labrum, even if I think in the back of my mind there's a possibility that their labrum is a little bit irritated, I'm not going to talk about their labrum. You got to be really careful about like what seeds you plant in people's heads and what is kind of the most important. If it's someone who like is more serious, more stuff has been going on, like it's been this longer thing and I think their labrum's irritated, then sure, like we can bring that up and talk about it. But I'm really careful not to like over medicalize people unless like their story says that we need to like dig down into all of that essentially. So if I write down on the board what's going on at the end of the evaluation, I write down like the local and the global of what's going on. I might point to a specific tissue. I might also say the side of your right hip hurts, the tissue there is getting overloaded, and the tissue that like refers to that area is getting overloaded. And then I tell them, this is the more important part of like why the side of your hip is getting overloaded, the global picture. You've got increased tension through your right quad, your right hip flexor, your glute med, your TFL. Everything along this is sort of just locked up, and you've got right-sided compression and you're shifting to your right side. So like, for some reason your body is oriented towards compression and stability on this side. Your body's not dumb, it's doing that for a reason. What can we do to help your body know it doesn't need to create all this muscle tension around this hip, around this side, that both sides can kind of share the load? Another thing for a runner, a lot of times that happens is there's decreased hip extension. So we would talk about why that would play into the side of the hip getting overloaded as well. Here's another case. This is an eval that I had last week. This is not somebody who is a typical endurance athlete that we see all the time, so I question putting her in here, but I thought it was a really good example of like showing you what I would write down on the board, the types of conversations that I'm like having with folks. This is a relatively typical person that we see who has like multiple things going on. So her big things where she has right-sided low back pain and right-sided knee pain. She had an ACL repair that was a couple years ago that she never fully rehabbed from, and she's got like a lot of back tension that is kind of like making daily life suck. She's a former runner and a soccer player, but hasn't been able to get back to running since she tore her ACL because her rehab essentially like stopped a little bit too early, and she currently climbs. So the local things that I told her about was that she had increased tension through all of the muscles or a lot of the muscles throughout her back, and that like her ACL recovery had like stopped essentially a little bit too early, that like her previous PT hadn't like helped her grade back into running and back into like what she should have been doing. And you know, that happens a lot of time for a bunch of different reasons. Sometimes it's on the PT, sometimes it's on the like client or the patient for not following through. But I will say that we see like a good number of like incomplete like ACL rehabs at Eastside, folks who never get back to like whatever it is that they want to do. So I told her at your back, there's a couple things playing into this increased back tension. Your rib cage lives in a like upward position. Your pelvis lives relatively forward. She essentially stood like this. It's like, cool, your back muscles doing the job of like holding you up most of the time. They're overworked and underpaid. I need to get everything around your chest, your abs, your legs to like help share what's going on. The other thing for her ACL, she actually had a pretty big like scar tissue restriction around like one of her ACL scars, which can definitely impact folks, and is something that like isn't that hard to clean up as a physical therapist or even as like a regular person if you know what to do. But I kind of think of scar tissue mobility as like, if somebody has a scar, and that scar, like the skin over that scar can't move as well as the skin like over any other part of the body, then what happens, it's almost like you can imagine like somebody wearing a onesie and taking a little clothespin and like clothespinning it right there. Every time you try to move, that like scar, the skin over the scar and the scar itself can't glide and slide as well as it wants to, which can irritate things and make things kind of suck. So anytime you see a scar on somebody, especially if it is in the neighborhood of what's going on, just like put your fingers on it, wiggle it around and see if it can wiggle in like all directions the same way that like the skin on the other side can. And if it can't, you literally just do like little wiggles like around to like help it. You get your client to do that. You can also do some like dry needling around the area and that helps speed things up. But even if the scar is over a year old, you can still get some changes in like the way that a scar can move, which is really awesome, and has already helped her out a little bit. She also had a ton of increased muscle tension around the ACL. So like her quadriadductor, hip flexor were all holding like a ton of tension on that side. So much so that when I went to like check that tension, like compared to the other side, she like giggled and like flinched away. And it's like, okay, cool. Body is still protecting you from something. All of the muscles in this area need to learn how to like contract when it's time and let go when it's time. And your muscles are stuck in like sort of this twilight zone of being like, oh, I'm kind of guarding, which again happens a lot after an ACL. The way that I explain things to people in a way that helps them understand why the way that they move, why their range of motion, why like asymmetries matter, is that I'll write on the board incomplete mechanics. So we've come up so far with ways that you're moving a little bit funky, things that are different from the right side to the left side. We don't have to be perfectly symmetrical to live a good life. So, you know, sometimes we have some incomplete mechanics and it's totally fine. Other times enough stuff gets stacked up where these incomplete mechanics start to cause some incidents. Incidents are things where you notice like your back's off, your knees off, but it doesn't really cause you to drastically modify your behavior. But unfortunately, our bodies are really smart, / fortunately, our body is really smart. So if we're having to kind of compensate around something, these incidents can cause us to like move a little bit funkier, essentially, and change things. Sometimes if enough of these build up going back and forth, eventually we get to full-blown injury. Full-blown injury is I woke up and my back is so flared up that like it's hard to stand up straight. I can't go and do my like day. And again, if we don't do something to help address why this is happening in the first place, sometimes that stacks up and changes the way that we're moving. So the whole goal of PT is to like help work on the things that are causing these injuries and incidents. So we're essentially working on these incomplete mechanics to help move you forward, with the knowledge that, again, we don't have to move perfectly. We just need to like start working against our body's patterns. Okay. The other big thing, people need a reason for their pain. Most of the people that I see in my practice have been folks who have been in pain for more than just a little while. if people have only been in pain for a little while, they might not need as big of a reason for their pain, but pain is this really complicated, difficult thing. And if people don't understand like why they're in pain and what they need to get out of it, it becomes a whole lot harder for them to get out of pain. And this is like a duh thing, but like you need to take that really seriously as the physical therapist, like doing the evaluation, and talk to people about like, this is what's going on, this is the reality, this is what's leading into your pain, and this is what we're going to do to help make things better, without, again, like over medicalizing things or like explaining things in words that the person in front of you like doesn't actually understand. So I tell folks that like I want them to be able to like go home and tell like to call their friend or their mom or their partner, whoever it is, and to say like, oh yeah, I saw Amy, it was awesome, and I've got knee pain, and she said that like here are two of the things that are playing into why I have knee pain. That's super important for like the person to be able to tell somebody else important to them like what's going on. Your overall like goal and job is to be like a detective and a storyteller like for these people, to help them connect with what's going on so you can help them gracefully, move out of it. Communicating clearly throughout the eval is critical. You really want to bring people, you don't have to comment on every single test or thing that you do, but it's really helpful as you're going through to make some commentary on, oh, hey, like your internal rotation is different on this side versus the other side. I'm going to write that down. That could be part of what's going on. It could explain why this hip is moving differently than what the other hip is. And like, it doesn't even have to, you don't have to give people like a crazy thorough biomechanical explanation that you would want. You just have to bring them along with you through the eval instead of like silently going through stuff. That helps. It's also helpful to like chat people up about the rest of their life as you're kind of going through this process, just so that they're getting to know you as like a real person. But yeah, super helpful to like bring people along with you, communicate clearly, go slow enough, and make sure that the person is understanding like what's going on and what you're thinking is happening as you're kind of working through. The other thing that I think is true, people need to have an experience with a capital E in your clinic to get over pain that's been around for more than just a little while. What I mean by that is that like, if I'm choosing to do manual therapy with somebody and let's say somebody's got low back pain, it's a runner who has low back pain, really common, and like I check their back, I think it's worth doing some dry needling or some like tissue work on their back, and like as I'm doing the dry needling or the tissue work, they're cool as a cucumber, like nothing's going on. I'm actually like starting to get nervous and get a little bit sweaty myself, because that means that like the irritation, like this tissue tension isn't super directly associated with their pain or isn't, part of what's going on. It's like, if I'm choosing to do manual therapy on a place, it like the person needs to be a little bit uncomfortable, a little bit sweaty, a little bit something that's going on that tells you that like you're working on a spot. As long as you're in a spot that's like relevant to what's going on, it means that like you're doing something that could help out. You're going to find later if it's actually going to help out. But like if the person on the table doesn't think that what you're doing is actually changing anything, then like, and they're not bought into what's going on, like it's going to be a lot harder for you to get them out of pain. So tissue needs like a good amount of input to help it move forward and to like give the body enough input to like change what's going on, is one side of it. The other side of it is like the person on the table believing that like you know what you're doing and that you can actually help them. The same thing is true with exercise. There are some exercises where like the like some of the neuromotor, like neuromuscular and sort of motor control exercises that I tell people, you're not going to feel a whole lot during this one. That's kind of the point. Most of my exercises, it's like, I want you to feel your X, Y, or Z and like make it suck is what I tell people a lot of the time, or we are going to make it suck. Again, like if you don't challenge people, if you don't stir things up, your chances of helping them get over it become a lot smaller. Give people an experience. Okay, cool. Questions so far? I'm going to give you all a break in just a little bit since we're coming up on an hour. No. Okay, cool. Let's talk about manual therapy. Okay, so people have a lot of different opinions on manual therapy in our profession right now. Some people, all they do is manual therapy as a physical therapist. Some people don't want to touch their like patients or their clients at all because they just don't want to. The thing about manual is that like it does require a like attunement with both yourself and with the person on the table to understand like the data that you're collecting from the way that somebody's tissue feels. And like it is like a, I don't want to say like intimate thing, but it's like it's a very personal thing to like touch somebody else's body and like some of the ways that like we're like touching people. And like I think it's a shame when like physical therapists have an example of a SPT that I was like talking with about manual therapy, kind of like debating on it, and he was like, well, I get manual therapy done on my body and I think it's helpful, but I just don't want to do it because it takes too much energy and like it makes me feel like emotionally tired and like physically tired if I'm doing my like manual therapy on the like people that I'm treating. And I'm like, that's crazy. Like you need to build up some endurance and get over it. Like if you think a tool is helpful for you, you don't want to offer that to other people. Yeah, the like it's not always easy, but like a lot of our job is like physically taxing on like our brains and our hands and like our bodies. And like if you think something is helpful, like you got to figure out a way to like incorporate it into your practice. You can't just be like, nope, that's too hard, I don't want to do it. So you know, there's a balance, at least in my personal practice, of like using manual therapy, balancing it with exercise. I think that like only doing like one treatment approach obviously doesn't set you up for success quite as well. But I do believe in manual therapy as a like powerful tool to help facilitate sustained change. I do think it's harder to like help people out of pain if you don't put them on the table and if you just jump in with exercise. That doesn't mean that every single person gets manual therapy, but it does mean that like a lot of my clients get manual therapy in some way, like at some point. Yeah, it's a really helpful tool to help people move forward. And if you're not so sure about that, I would really challenge you to, I don't know, have some experiences on your own body, see how it works out with other people, and like critically kind of examine what's going on. The other thing is that like anything passive done by itself does not cause long-term change. I'm super aware of that. I don't think that I'm changing anybody's life in a insanely profound way in one session based off of the manual therapy that I did. But again, like there's a compounding effect of like manual therapy and exercise paired together that like people do get a benefit from. So that is, you know, part of what I take through my practice. It also like, it's really frustrating at first when you can't feel anything because you haven't put your hands on enough like different bodies yet. But like, I promise you, if you start to practice and you start to pay attention to like what you're feeling and you just like take a little bit of pressure off and don't like expect yourself to be as good as like your clinical instructors or your like professors at identifying things, that you're going to start to like see differences. And like you always need to compare people to their own body as best as you can. So if somebody has right hip pain, I'm scanning both the right and the left hip, and I'm looking for differences between those two sides. And if it's like close enough that I can't tell a difference, then it's like, okay, cool, move on. And like muscle tension isn't like part of the problem. Muscle tension in this area isn't part of the problem. But yeah, I was super frustrated on clinicals. I did a rotation at Champion Performance, not too far from here in Cedar Park. And CP, who owns that practice, was my CI, and she would feel somebody's neck and do like a joint assessment and a muscle assessment, and then essentially like have me trade places and like report back to her what I had like felt. I was not as good as what CP was at like identifying what was going on. Like, how could I have been? I was a student with like this much experience so far. But like with time and with practice and with getting your hands on a bunch of bodies and with comparing what you were feeling with what your CI is feeling and then feeling again and seeing if you can like pick up on that, connect those dots, your brain becomes more attuned to your fingertips. And, before long, your clients and your patients are going to be saying, how did you know that was tender? That's the other thing. I always check in with clients, like, was that spicy? Was that tender? And a lot of times I know the answer is going to be yes, but you want to know that, like, again, tension is associated with like tenderness because it isn't always. And that is helpful to know about as well. There's a bunch of different types of manual. Again, it's a passive modality that involves asking for a change in somebody's tissue. So to some extent, like different types of like soft tissue mobilization between like massage, cupping, scraping, people who are big fans of one of those can get really like bound up about like, this is the way. It's all in the same bucket. If you ask me, like scraping is nice because it's a little bit of a break on your hands. It's not as like hand intensive or hand muscle intensive. If a client has a preference for one, I might use it over the other. My overall preference is for dry needling most of the time, just because with all of these other things, you're mostly impacting like the most superficial layer of like skin and muscle, and dry needling actually lets you get kind of like deeper down with what's going on. Not everybody's going to tolerate dry needling, so you're not going to do it with everybody. I also think joint mobs and joint manips can be helpful kind of in the right context. I do a lot fewer manips now than what I did coming out of school. I'm just much more selective about what I will do. I'm pretty big on manipping like the foot and the ankle and like the T-spine. I've got like mixed opinions at this point about manipulating some of the other parts of the body, just based off of like what I've seen, what I've like felt, what I've learned. But like those two places I use manips on like really frequently. I do mobs all over the body, and joint mobs are super helpful. The other thing is like, if you're going to do manual therapy, you need to give somebody something they can work on at home. And if you think that tissue tension is a problem, then like, again, you doing something one time can give somebody a boost, but isn't going to help solve the problem. So most of the time, like people get sent home with like lacrosse ball, Theracane, foam roller, whatever it is, and specific instruction on how to get into like the places that I need them to get into. So I was, based on my clinicals and like what I saw and sort of just like what I was indoctrinated into, I wasn't super into like foam rolling, lacrosse ball work, that kind of thing, until like later in my practice when I learned some more stuff. I don't know how I got on like for so long without like having people do some of that work at home. It's super duper helpful. I am picky about the way I instruct that with people. So instead of it just being like a roll kind of thing, usually I've already like identified, okay, there's a spot in your quad that's going to need more attention. I'm going to have you like put the lacrosse ball there, lie down on top of it. You can scan or roll like in the neighborhood to find what spot is most spicy, most interesting. Then you're going to stay on that spot until it becomes less spicy. That might take 10 seconds. It might take 30 seconds. It might take a minute. After it starts to become less spicy, you're going to move to another spot in the neighborhood and get into that spot as well. You're going to do 2 minutes of that, 5 minutes of that, whatever I think that they need. And that's my preference for how to instruct people on how to do soft tissue work. Again, I tell people it needs to feel like something is happening. So it needs to feel like a 5 to a 7 out of 10, maybe an 8. Don't do a 9 or a 10, use less pressure, back off, use something that has like a bigger surface area. So, you know, if the lacrosse ball is too intense, use the foam roller. If we're working on the bottom of the foot and the lacrosse ball isn't good enough, get a golf ball. Like find something that's going to match with the like part of the body. So I am a big fan of that for my own body and for other people's bodies, and wish I would have started doing that sooner. Honestly, I went to the like APTA CSM. I think it was my last year, and the Theracane people were giving out free Theracanes, and because of like essentially other PTs impacting like what I thought, which, you know, you're just kind of like a little parrot at first for other things that people that you like are saying. I was like, Theracanes, you shouldn't use a Theracane. That's a silly tool. I tell people to use a Theracane all the time. It's awesome for like getting into nasty spots around the like shoulder and around the like mid back. And it's really easy for people to use at their desk. So like if somebody's got mid back pain, I'm definitely telling them like get a Theracane, like get into some of those nasty spots in between our sessions so that we can make faster progress. The other thing I tell people a lot of time with the Theracane, obviously there's like certain areas in the body that you wouldn't want a ton of pressure for any of these tissue tools. I tell them like squishy and like tender is probably good. Anywhere that's like bony or hard, do not press on. That's not a good thing. You obviously have to be careful around people's ribs, because if people were to press really hard on one of their ribs, they could give themselves a little fracture, which is really not cute. So I tell people about the ribs, be careful, stay next to the middle of your spine, tell people exactly where it is, watch them set it up. I also tell folks, if you find a spot, let's say I'm having somebody work on their pec, if you find a spot in your pec that sends like zaps or tinglies down your arm, you're in a spot that's too close to all the nerves that go down your arm. Move to a different spot. We want a spot that is like locally nasty, not like referring or sending pain nasty. And you keep it simple, kind of like that. People are really good at finding spots if you give them the right tools to be able to do that. Okay, so my manual process, this is, we have a team for the MS 150, which is a charity bike ride that raises money for the National Multiple Sclerosis Society. This is one of my friends who is also a client. She had some like pretty nasty hip and back pain come up on the ride, and when we were at a rest stop was like, Amy, can you please do something? And then she regretted saying that because I really dug the front of my hand into the like front of her hip, and she was having a bad time. But yeah, that's me helping her out a little bit. She did tell me 20 minutes later that she was feeling better and she was glad that she went through that. But again, give people an experience. It kind of needs to suck. In general, my manual process is that I'm scanning areas related to the client's pain. So I want to know in an eval and in like the sessions after that, I want a little report of like, okay, if I think that like somebody's hip flexor being locked up is related to their like back pain, I'm going to scan the iliacus, I'm going to scan the like TFL, scan the glute med, scan the quad, scan the like rectus, femoris, and get a little picture of like what's going on, how tender is it, how different does it feel from the other side, and then I'm going to go after some spots, maybe with some massage, maybe with needling, maybe with a little bit of both. But I'm looking for a spot that's spicy or sensitive and or limited in like motion in some way. I'm going to ask the body for change, i.e. I'm going to needle, I'm going to get into it with soft tissue, and then I'm going to reevaluate. I'm going to put my hands right back on that muscle. Does it feel different? Is the movement better? Eventually have the client stand up. How's the client feel? To like help me decide if like the spots that I was going after were worth going after or not, so that I can, tailor what's going on to what people need. Okay, we're gonna take a little break. When we come back, we're gonna go through a like common like flow that I would use to evaluate, and then to like do some soft tissue around the hip. Let's be back in 10 minutes. So that would be 2:05. How's it going?
Doing well, yourself?
Doing good.
It's fun seeing some of the like stuff that I've slowly started reasoning through and implementing like in my massage practice.
Yeah.
Like, kind of peeking through here as well. It's like, oh, cool.
Yeah. Hopefully this is a boost of focus on not just the two things, focus on a bunch of different things.
I feel like I'm starting to slowly get better at like that really global picture. I think I talked with you a little bit about the person with the toe and the yeah. So it's like it's been cool to kind of like start piecing those things together, and I can't wait to really just get my hands on more patients at this point. I just wanna,
it's exciting.
Figure it out more.
Nice.
But yeah, no, it's cool. It's always nice to have like validating, like that's a good pathway, like that's a good direction.
For sure, absolutely.
I did want to ask out of curiosity, do you know of any performance clinics like in northern San Antonio area or anything? Like
Ooh.
I'm trying to figure out my fourth clinic.
Let me see.
I was kind of considering maybe trying something along these lines because I do like with your the three categories that you put people on, the
reset, restore, fortify.
Yeah, exactly. I oftentimes will talk with my patients about like that bulletproofing process. Like it's like, okay, you're feeling better, but we want to make sure that you stay feeling better.
For sure. Yeah.
So it's like I really like going that extra mile.
Yep, helping people connect the dots because like they don't know, they just want to be out of pain.
Exactly. So I'm definitely hearing what you're saying about like insurance base is oftentimes going to get cut off because they're just like, well, they're good now.
For sure.
And it's like but just because they're good doesn't mean the job's done. Like this is going to come back if we don't really integrate it in their life and how they are and move.
Yeah. I know there's actually, my sister used to live in San Antonio, so I know of several different PTs in the area. I'm just trying to see.
Yeah, I'm pretty far on the north side. Like I'm technically out in Bulverde.
Okay.
So like closer to Spruce Ranch. I know there's
I know a lot of people in San Antonio actually. Okay, cool.
Because one of my rotations is going to be with wind physical therapy.
Okay. Yeah. Is Gabby still there?
I have no idea.
Okay, let me see if Gabby's still there. Do you know who your CI is going to be?
I don't, not yet. I haven't gotten the information. They are confirmed, but my understanding is they do a lot of one-on-one stuff there.
I have heard that,
so I don't think they have any techs or anything.
That's cool.
So that's usually a good sign for one-on-one, right?
It's a great sign, yep. My friend Gabby, who was in the class ahead of me, used to work at Mint, but let me see. Oh, their team is big.
You mind if I?
No, go for it. I know, come on back.
Do you have any plans with anything I'm not supposed to?
Oh no, you're totally good. Who else? Oh, Chris is here. Chris is also from the class ahead of me. He's great. Really nice guy. I actually lived with him for a semester with a couple other people.
Oh, was there an Abigail? No, Abby.
No, that's not Gabby. Gabby's one of the smartest PTs that I had talked to, just like super duper smart. Yeah, Gabby doesn't look like she's here anymore, but even if Chris isn't your CI, you should.
I think it's pretty versatile. Yeah. Put it in your cart. If you're still thinking about it tomorrow, like, full send it.
Oh, for sure. I'm not buying anything today. I'm just kidding. I got you. Edwin?
I mean, I think we should. I mean,
I feel like that was heavily.
maybe like you need to give someone experience.
And
And people hate
these are my period.
Complete athlete Andrew also
Because then I was like, wait, I was on the other I didn't get that was that one. That one
That's usually when like you don't get both.
insurance and cash.
I didn't call my brother because he was like, like you're paying her to walk behind.
She can't get it.
Yeah, and so I did all of them.
If somebody doesn't
And I
have
was able to get all of it, and like every single time I did it, he like talked to your higher than the cash rate. We needed this.
person or maybe the person's or use their like 15 visits.
Yeah.
The cash rate.
Like, for real?
She's also taking care of that.
I think my right.
Joe's smart. Yeah, I'm trying to look for.
Yeah, there's a concept that I saw where basically like all pharmacies would offer a discount program to sign up for.
Yeah.
And like that way it wasn't insurance fraud because there's like it's technically not a cash fraud because technically you're not paying. You sign up for the discount program that reduction.
Yeah,
I wonder if that's
so I also wondered how we'll get around that because certain insurance contracts are like
I was gonna say that's my bad angle.
yeah, you're also there.
Where'd you get that? Huh? I heard. Okay, you said. I was like, oh my. Mm-hmm. She's like, oh, you forget that. The way I was like, wait, what are we doing? You.
They're pretty good too.
A little?
I heard it.
I did the healer because I was not touching his feet with my bare hands. It's not funny, but
You're like green to yellow light.
Yeah. Once a week. Grandson, let it calm down.
There you go. Let it calm down.
The cycle for the rest of my life.
This is side. It was not like
Where did you get this energy from? I don't
Next Tuesday, and I can buy them now.
Some people would argue that you can't enter
I don't know. I just didn't really want to we gotta fix the cheese. Where are we finding cheese?
All right, y'all ready? Let's do it. Anybody in here got some Bitcoin? Me? You? Yeah, come on up. You're like, actually. For so long now. For so long. She's still here? Yeah. What side of your hip bothers you? Left side. Okay, and where? Okay, cool. Season. Okay, so if I am, looking at somebody's hip, this is a really common thing that I would do at the end of an evaluation. Essentially, I do like all of my little tests, and I save like palpation and special tests for the end. Kind of depends on what order I do them, but I tend to find too that like people a lot of times will like check joint accessory mobility, but won't check like the actual like tissue tension around the area. I do think you leave a lot on the table if you don't have a sense of like what the muscle tension pattern is around a certain body part. So if you got hip pain, obviously I care about your hip. If you got knee pain, I care about your hip. So if you come in with knee pain, I'm gonna scan essentially like this part of your body. I'm also gonna scan this part of your body. I'm gonna look at your foot too, maybe not initially, but definitely coming up to it. Yeah, so I will also do this as like a pulse check at the like beginning of the session as well. So typically I'm gonna start with the person's uninvolved side first to kind of catch a vibe, and I'm gonna move the person up in a hip flexion. I'm just seeing how things feel at end range. I might even give them a little wiggle around sort of through here. I'm not scouring them or putting a bunch of extra pressure. I'm just seeing how easy it is for the hip to kind of move around here. I'm gonna go into internal rotation, external rotation, and I'm just kind of marking in my head roughly what it is. I'm looking for things that are drastically different from side to side. From there, I've done hip flexion, I've gone internal, external rotation. I'm usually gonna put my hand right on the side of the hip into like glute med and check how that goes next. So I'm pressing in here, and then I'm gonna give her like knee essentially some wiggles kind of across her body. This is just kind of the way that I tend to do it. You don't have to do the wiggles. Little wiggles tend to help people let go of any extra muscle tension. I'm now on the TFL here, kind of checking things out. If you wanted to double check that you were on TFL, you'd find the ASIS and essentially slide right off of it, kind of at a little diagonal. And again, I'm looking for how does it feel under my hands? Is it ropey? Is it tense? Is the person like wincing or kind of like tensing up a little bit? Are they making a face? And I'm gonna just kind of check all around the like glute med. Again, giving some wiggles. From there, I'm usually checking across the like front of the like quad and the hip flexor, kind of seeing what we got there. And I'm using, you have to give like a ballpark of like the level of pressure that I'm using on like a 1 to 10 scale. What would you call it? Like a 2. It's not a ton. It's a little bit, I'm not really like trying to ask the body for like change right now. I'm just kind of doing a vibe check. I'm usually going across there. I will then like let the person's knee hang against my shoulder. I'll tell them to relax against my shoulder if they haven't, and I'm checking the adductor. If you need to give somebody a warning that like, hey, I'm gonna be kind of like up in your groin, you can do that. Usually I say, hey, I'm gonna check your adductor, your inner thigh muscle before going for it. And then check kind of along the length. You can also check along the length of the quad. I do a lot of times like medial and lateral at the same time, and then come back for rectus to see what the vibe is. I'm also going to check iliacus, so I'm going to find the ASIS. I'm going to slide either my thumb or my fingers right into that. I'm pressing straight down posteriorly, then maybe slightly back laterally as I'm checking things out. Probably kind of ticklish or kind of tender. Yeah, this one's a little bit more pressure because you got to go through more tissue to get there. And then again, I'm kind of rocking the leg out and seeing how does that feel. Okay, and then if you're not talking, it takes not as much time to go through all of that. I'm going to show you on the other side. Okay, so already there's more tension coming up into hip flexion on this side. That makes sense if your hips been bothering here. I'm going to check internal rotation. That's relatively similar. Does that bother you a little bit? Is that okay? That's really cool. External. That's close enough to the other side that I'm not going to make a big deal about it. Go ahead and set her down. We're checking glute med. And it feels a little bit different than the other side, especially the like the anterior portion of the glute med. The middle portion doesn't feel quite as yucky to me. How's that feeling? And I'm checking more like posterior lateral. I can't get like super posterior with position. I'm checking TFL. That feels like it's probably a little bit knocky as well. Not too bad. A little bit, not crazy. And I'm gonna check the flexor. Again, I kind of go, your thumb doesn't feel as well as the rest of your fingers does, but or do, but sometimes the leverage of the thumb is just like a little bit better. Pressing 2. How's that feel? Similar to the other side? That's what felt to me. So far, glute med kind of felt the most interesting. And I can feel, check rectus. More tension through this adductor, more tender. Feel it. Okay. Cool. And then, you know, there's for a hip, I would also screen the light flow back as well, but that would be like for this part of the body what I would do for the hip. Questions on any of that? Cool. And you can kind of run through a little flow of exactly how things go, right? But let's, I'll put back on the screen the little list of what you're going to check for, and if I feel like there's some more things to check for, I'll make a list you can kind of go through, but let's practice for a little bit. I'll walk around, if you need help, you know, raise your hand, say, hey,
In person. Thank you.
If you get through that screen and you found something on your partner that was kind of yucky, and maybe related to something you haven't, go ahead and get in there.
Just back.
I'm And when I was golfing, the left hip. Did anyone have pitch injury?
Hip pain, knee pain, back pain.
Oh, the popping?
Mine was like in my bed. Really?
Yeah, maybe a little bit. No, I'm just so sensitive.
It's like kind of
I'm just checking.
yeah, you're looking for, and this will come with more
Probably be like, I did.
Yeah, that's like nothing much. Yeah, I don't think
expect to add more than what you're looking like side to side, right? You're strumming and so yeah, see if there's anything interesting. A lot of time when I feel one side, I don't really have any commentary yet because it's like I don't know what it is.
Why is it moving?
it's not glazed, but
It's all good. It has a liner.
Also, I think I'm being really gentle. I think I'm being gentle. You just go in there.
even like especially through the whole through your best.
Also on my right side.
It's like what's your dollar for the super right?
I actually calmed down. No, she's purple. It's like I would be
That's fair. I'm not doing that.
Oh, wrong.
That's why I wanted to get.
Okay. Come on. Are you ready? Ready? Man. Now you can go look for it. Yeah, about that.
Another thing that I would actually have that is, it's like very oh my god, it's like watching the side of the hip and it's like lack of like stabilization, right? So there's something about like running a dynamic this doesn't have the side that's so hasn't like down with. There's a bunch of different ways to work on that. One that kind of like baseline pod is working on is like knee. That's like second so that's like adduction or like abduction. Usually people are already working on like abduction in some way.
It sounds fun.
Yeah.
I feel like you can just go on. I don't do step up.
I really don't.
I don't do that. Wow.
I think my left hip is you said my right hip was terrible on that side.
Okay, then you and leg down.
Okay, I wasn't good. So if I have a lot of
If the person's already grimacing and it's like then like you're good. But like if they're not grimacing or like panning and like so yeah, I agree with you. Have more external on your leg that feels just like getting
and then quantum, medial lacteal
TFL jams up the hips a lot of the time. But yeah, the other loading of when you're doing it, it's like proposal work, like it's hard to like TFL she's not weak. Yeah. She's different. Yeah, so getting into that. Also,
You're right-handed? I'm the same way.
When you were doing the palpitations on this leg, it was more sensitive because it was.
I got an overall note for everybody. Use more pressure. So like when you're first checking in on somebody, like a 2 or a 3 is totally fine. But if they're fine and they're not wincing and everything's all good, like lay down more pressure. You can go up to like a 7 or an 8 out of 10 pressure, and you really are looking for. It's like on their injured side, I'm looking for a spot that makes them kind of grimace a little bit or makes them make a face. Like you're looking for a spot that sucks. So yeah, use more pressure. And then I have another thing to say. I think that was it. Did everybody find? Everybody should be able to find at least like one spicy spot on like their partner, more than likely, if you use enough pressure. Did everybody find like at least one spot? Yeah. If you didn't, let me know, and I will come check your leg and see if there's truly no spicy spots.
And when he said he was like, Mom, I was like, oh! I was like, what do you say? My back's already No, when I was treating people, I was like, okay, I didn't know where home was right now. It's 7:00. Are we gonna tell? And he comes by, he's like, what do you tell for I think you're doing good. And he was like, there's one thing. And then I was like, I like to twist it like both ways, try to undo it and it's not coming out. It's like too nice. And just like, it's like,
I don't have to.
Try it. I'm probably
Yeah,
like,
yeah. Like, I don't actually. I don't even like. You know, like, I just.
Okay, I think I'm done with that. Wait, I don't think I'm done with that. Okay. Yeah, once you're done, I'm gonna save those last.
So what checks like what keeps it
Like here?
what like stops this motion from happening sooner? Like it's stopping sooner than after. If like you're good, you're supposed to use like rotation here. Is there a limitation to what's hitting the brakes? What's not saying it's stopping
I think I have 2 small hands.
I'm on this side. This hand over here, this hand.
Okay. Did you guys? I think I found just like.
Yeah. That's actually really funny because when I was in clinic, Dr. Rich, I like had a
Step on here?
Dr. Rich,
No, no, you guys are on this side.
So,
like sometimes
alright, let's do it. Let's put your weapon on.
your rectus might not be
I was gonna say, I couldn't tell if that was wouldn't it be? That was like a creative.
Any questions? Fun. Find me a good spot.
Oh.
Any other questions?
You know, elevator my shoulders and my secret and I'm here. It is backwards. Myra.
He's like, what am I signing up?
No party trick.
Huh?
No party trick.
No, I don't want that one.
But I would do this one.
Does that make sense? If I were telling somebody like what to start out with, I'd be like, hey, and then like that helps. Like 2 minutes if you have time, and like do 5 minutes. But like someone's always better than none, and getting your body consistent. We answered that question in this class as well, because that's a really good question. It's the typical speed through like performance.
I've got a question from Ian and a question from Irene that I feel like are helpful to tell you all about. Ian's question was about like, okay, you find a spicy spot and then you start to work on it. And I didn't talk too much about the like starting to work on it part, but it is essentially like you find the spicy spot and you hang out until it becomes less spicy. You're not gonna like rebuild Rome in a day, so like you're not expecting to like completely desensitize a spot like immediately, but you're looking for it to like feel different under your fingertips. You're also looking for it to like feel different to the like person. So you could ask like, hey, is that still as tender? And try to use about the same amount of pressure that you did initially. A lot of times, if you did enough tissue work, the answer is going to be, huh, you know what? No, that's not as bad, which is great. But the question is, you can ask your question one more time with the, how you worded it.
How much of the change is structural versus not psychological, but
Like brain body connection, nervous system. Yeah, so it's a really good question. Typically the way that I explain it to like the person on the table is like your body's been stuck in this like place of low grade, medium grade, whatever it is, tension. And like having that much muscle tension around your quad, for example, is kind of like having the parking brake in your car on. You can drive around with your parking brake on, your car is not really gonna appreciate it. So like this extra tension creates just like extra friction or extra resistance to like movement happening. So when you are actually like stepping on your leg and using your quad, your brain needs to communicate to your spinal cord, all the way down to your leg to get tracked. But then when you come off of that, it should chill out some, right? And especially when you're lying on a table, like letting go of tension, it should be pretty chill. But the question being of like, structurally, what is happening versus like nervous system wise, what is happening? The answer is that like, as far as we know, you're getting a little bit of both, right? So like at the local level, by like touching somebody and by doing that kind of compression, when you move your hands away after you've done a ton of compression, it essentially like causes like more blood flow to come into that area because you've essentially like created a like pressure change around that area. Along with that increased blood flow can come some extra like healing cells and healing chemicals, things that are gonna make like a small change over time. If you needle, you're gonna get a bigger response because you've made essentially a tiny baby hole, and then the body comes in with its own pharmacy to fill in that hole. You get a smaller version of that if you're doing like compressive, that's sort of like manual therapy. The bigger thing that happens versus the like increased blood flow is that like you're asking for a change from this person's nervous system. So by essentially like forcing the body, you're like pointing out to the body like, hey, you're holding too much tension here. I'm gonna hold like extra pressure here and see if like it will slowly let go. You're telling the nervous system, you're asking the nervous system essentially for like a hard reset to like cool it on like the little like nerve fibers that are like going like fire, 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 fire to the quad. With like dry needling, manual therapy, whatever it is, it essentially like calms down or like decreases the rate of that firing, which causes the muscle like not hold so much tension. So it's sort of like a little reset at the like neuromuscular far as like studies that I've read have been able to tell is like part of what's happening. Does that make sense? Yeah, cool. And then Irene, ask me your question one more time.
About like dosing and like when you talk about how
Yeah. Yeah. For sure. And when you're telling somebody to do something at home, I usually context it telling them like, hey, you know, we spent 30 minutes, 15 minutes, 45 minutes, whatever it was, on the table working on this so that I could give you a big boost forward essentially. I need you to still do some of this at home so that your body like, you know, is more open to the change that we're asking to happen, because your body's gonna need that reminder kind of over and over again over like the next little bit of time. So I might tell somebody like, it's also like, it's gotta fit into somebody's life and it's gotta become like a consistent thing. So if somebody's super busy, I might tell them like, hey, can you get a minute of this done like once a day? If there's somebody who has a little bit more time, who's super eager, it might be like, hey, spend 5 minutes around your hip just like scanning for nasty spots and then spending some time on the nasty spots, or maybe even 10 minutes. I tend not to tell people to go over 10 minutes just because I'm usually asking them to do other things with like their time that I also think are worth doing. In terms of dosing it like on the table within a session for somebody, there's a lot of art that goes into deciding like how much to do, and you're kind of weighing that against like, what else do I want to get done like for this person in this session? Like, how important is it for me to introduce like an exercise or like something else? I almost always like, on the eval, I don't always send somebody home with something to like work on. Sometimes I do. After like the first like regular treatment session, I'm giving the person something to like go home and like start to do. So I'm not gonna do manual for like 55 minutes and then like not give them something like actually actionable to do. And usually I wanna give like lacrosse ball, self-soft tissue, and also like one other thing for the person to start working on. So I'm gonna make sure there's enough time. In general though, I'm kind of grading it to like how quickly the person's body starts to change. Like some spots you might only have to work on for like 30 seconds or a minute. Other times you might spend like 10 minutes like in the neighborhood of like one spot or one area, and as long as it's like slowly moving in the right direction, I might be like fine with that. It is harder to like grade that, and again, it depends on like how much you think that one spot needs the extra time versus how much you want to like put your eggs in some other baskets and work on some other areas or some other like strategies essentially. Does that make sense? The other thing is that like, this is not always true, but I tend to find that like folks who have been in pain for a longer amount of time, and a longer amount of time being like a year plus, tend to benefit from like more manual therapy, like reset work, if it seems like it's helping like downregulate the nervous system and like calm it down overall. I also got a question back there about like, well, I'm scared of giving somebody like too much like input, because what if I like, you know, flare their nervous system up, kind of like sensitize them, send them into overwhelm. I need, like, for a treatment session for some things to be spicy, but I don't want the person, like, sweating and, like, fighting for their life on the table for, like, the whole session or for, like, a ton of the session. I want them to feel like they're maybe fighting for their life in, like, a mild way for a little bit of the time so that they're convinced that something is happening. But I'm also grading, like, how do you feel when you get up? How do you feel when you, like, you know, go about the rest of your day, and adjusting it to that, as well as telling the person ahead of time, hey, like, I'm collecting data on how your nervous system is going to respond to a bunch of things. If we overshoot and do too much, like, that gives me valuable information, and is unfortunately just like part of, yeah, kind of like learning all of this and playing the game, so to speak. I also tell people, hey, during an eval, I'm purposely doing things that are like potentially gonna piss your hip off, your back off, whatever it is. Good news, I don't have to do those things like again, so awesome. So if you're a little bit irritated after the eval, it's okay. Know that like it's probably only gonna go like uphill from here, probably gonna like only get better from here, essentially. Context is also really helpful for helping people understand what's happening. Does that all make sense? Okay, sweet. All right, let's go to the next thing. Okay, I put education next. I put the stuff in this section. Some of it is stuff that like I've cobbled together based off of a bunch of things that I've like read and seen. Other stuff is like me directly borrowing from somebody else. Okay, so you gotta be the expert. You gotta speak the language of, if you're gonna treat a bunch of runners, you gotta speak the language of runners. You gotta know what races are coming up. You gotta know what heel striking is versus forefoot striking, so that when somebody asks you, you can answer. You got to know about shoes so that when somebody asks you what shoes should I be wearing or what do you think about these shoes, that you have something intelligible to say to them. So like personal continued involvement in sport is really helpful. It's awesome if you've done the sport before, that definitely helps. But like continuing to do whatever sport that is, like actively, like as your physical therapist, if you're trying to be a really sporty PT who treats whatever sport, it is really helpful to be like currently involved in the sport and to know the people in your city, your town, or whatever it is who are also playing that sport. You need opinions and definitive recommendations. We had somebody come in to like interview with us actually yesterday, and we have folks who interview with us do a like demo eval. It sucks because it's essentially like a practical situation and like it makes people nervous, but like I need to see like what your eval flow is and like how you interact with people before I agree that you should be on our team. So this guy came in and he was doing a demo eval on like one of our other PTs. And this other PT has some like hip pain that's been going on. She wanted to run the half marathon last year and essentially got injured. She ramped up her running too soon. And like she is a really good example of like the type of client we see where like she's made some progress, but she's not back to running and her hip still hurts and she needs help kind of navigating that. So his goal for the eval was to give her advice on why she, was still in this middle ground place, what she needs to work on, and he knew from the beginning that like she wanted to get back to running and that she wanted to get back to like lifting more, essentially. So at the end of the eval, he gave her some like pretty good specific advice on like both running and lifting, but he did not directly answer the question of like, okay, but when can I start running again? So our PT, the one who was the like demo client, looked at him and said, okay, when do you think I can go on my like first run or my next run? And he kind of like hemmed and hawed, like didn't really have a good answer. And he was like, well, have you tried running yet? Well, no. Well, how much were you running previously? Well, I was running up to like 10 miles previously. And he asked a bunch of questions to try to give himself enough context to like answer the question for her in an intelligible way. But it was obvious that he hasn't worked with like a ton of runners because he didn't have a way to advise her on like how to restart running. So like you need a definitive like set recommendation for like these are the parameters that help you gate return to run, and here's what a like good test first run should look like. And like if you haven't like learned some of this stuff or engaged in like sport, you're not going to have a definitive recommendation. You're going to be kind of waffly, and like there's a balance of like being really definitive and structured with like the client and like having some room for like where you do need to like waffle a little bit and be like, well, if it's a 1 to a 3 out of 10 in terms of pain, then like that's a green light and that means you can run through it. You got to have the like right balance and the right structure, because the question is always going to be when can I run, ride, do whatever again. Other thing that's really important is metaphors. I listened to a podcast while I was in school that talked about, that was like in the PT world, that talked about how people can't understand new information unless it is somehow linked to information that they already do understand. So like in the context of somebody like being in pain and not really knowing what's going on in their body, or maybe they know this much and you know like this much about like how bodies and nervous systems work, you like need to come up with like relatable ways to tell somebody about like what's happening in their body. So the example I just gave y'all of like too much muscle tension around an area causing more resistance, that's kind of highfalutin. The parking brake example of being like, it's like you got your parking brake on. Super like, something that people can actually relate to. CP at Champion is like the queen of metaphors, and I took a lot of metaphors from her. There was a metaphor that she had about like front of knee pain, where she was like, somebody had like some like fat pad proliferation, so their fat pad was puffy, their pain was at the front of the knee. We thought that the fat pad was like part of what was contributing to that, and she explained that as like, you know how when you bite the inside of your cheek, then it gets a little bit puffy, and then it gets easier to bite the inside of your cheek. That's sort of what's happening around your knee, where we need to, work on some things around your knee to make it to where like you're not just chomping on the same like irritated spot on the inside of your cheek. So it's kind of hard to go from like PT, anatomy, language, very clinical, very literature, very what you would read in a journal, to like talking to people just like normal humans. But the more that you can like pay attention to what like metaphors that some of your clinical instructors use and start like using them, the better you're going to be able to like relate to the people in front of you and to like help get them on the same page as you. Okay, a concept So these are all concepts that I talk with people about a lot in the clinic. So there's just like, if you're a runner, cyclist, or triathlete, or an endurance athlete, like there's a chunk of info that you're gonna get. This is a good chunk of that for a lot of people. So just resting is almost never the answer to like any injury with a mechanical problem, right? Mechanical problems need mechanical solutions. But folks think that like if their knee hurts or their foot hurts or whatever it is, well, I should just rest. And like, you know, if it's something that is truly minor and was from something else being overloaded, something else that was weird, yeah, sure, rest might make it go away. Do I ever see anybody in clinic that rest solves the problem for? No, I'm only biased towards people who like, they try to rest, and what happens is like, as they're resting, structures weaken further. Typically people then try to like jump back into activity at a level that is like too high because it's their previous level of activity. Unfortunately, a lot of time injury occurs and we get stuck in this like cycle. So telling people that like rest is not a good answer. Like pain is a request from your body for change or for something to be different. And if your body keeps sending you the same signal, just resting isn't a good enough answer for your body like to this problem that it's happening, essentially. None of this stuff is rocket science, but it's stuff that you need to like break down for your people in a way that like they can actually relate to it. The pain stop light, also not rocket science. This is something I use with almost everybody in clinic to help make decisions on like, did I do too much? Am I doing too much? What should I do? So I tell people, hey, usually the question is like, we're doing an exercise, or somebody tells me like, I went on a run and my knee hurt. And I say, okay, how much did your knee bother you? And instead of putting it on a 0 to 10 scale, I want them to tell me if it was green light pain, yellow light pain, or red light pain, and I've already explained to them what that means. So I say 1 to 10 scale, 1 is barely anything, 10 is the most pain that you can imagine. Pain is inherently subjective. I will never know what a 6 feels like in your body. You'll never know to me. It is your own scale. You gotta do the best with that with what you can. Because sometimes people will be like, well, I don't know how bad it is. And it's like, you are your only reference point. That is the way that this has to be. So a 1 to a 3 out of 10 is okay in the context of you being in PT. It means you are safe to continue. Your nervous system has some like feedback about what's going on. It does not mean that you're like actively causing like a big bad problem, because your nervous system is going to get your attention louder if that's happening. If the pain is a 4 to a 6 out of 10, that means you need to adjust down what you're doing. That doesn't mean stop it entirely, but that means back off on distance, back off on time, back off on intensity. And I've got another thing I'm about to show you that helps you show to people what all the variables are. If the pain is a 7 or above out of 10, that's a sign that we're way exceeding our body's capacity and what our nervous system would prefer. We need to scale way back. And I also tell folks you got to check in during the activity, after the activity, as well as the next morning. One of the tough things about bodies and why I have a job is that like pain does not always occur exactly like when like the problem is happening or when something that the body doesn't like is happening. We sometimes have a delayed response. Nerves a lot of time work that way. So I tell folks like it makes the problem solving harder, but you have to like, you know, sometimes it's helpful to keep a journal so that you can look back and say, okay, maybe I went too hard on that ride. Let me pull that back a little bit because I did have some yellow light pain come up like later on after the run. So yeah, I try to get away from people being like, it's a 3 or a 2 or whatever, and have them group it in like, it's green, okay, we're gonna keep moving. It's yellow, let's back off. It's red, ooh, okay, let's like really reevaluate and see kind of like what's going on. Okay, so one of the like, if we're in the yellow light zone, we need to back off some, but not all the way. The next thing is telling people about the FIT principle. I had ChatGPT make me some of these graphics, so if they're a little bit goofy, that is why, but I thought it looked nicer than me drawing everything on a whiteboard. So FIT with 2 T's are essentially all of the variables that help impact how much load or how much volume is happening for an athlete. So the way their body works, if we try to change only one of these at a time and it's not a like crazy increase, your body's probably going to be pretty happy with it. If we try to change 2 of these at a time, your body, and they're both like modest increases, your body's still probably going to tolerate it. The more variables that we change and the more drastically we change them, the more we increase the odds or the risk of things not going the way that we want them to go. And I usually, instead of just showing somebody a graphic, I draw this out on the board and talk with them through it. So I say frequency, that's the number of times per week you're doing whatever activity, intensity, speed, elevation, time, duration, and then type. So let's say you're currently running and biking, but you're not lifting. Let's say you keep the running and biking the same, but you go from lifting none to lifting like pretty heavy, like 4 times a week. There's a good chance your body might have something to say about that. unless we do a like gradual intro into things, right? Our bodies have a certain momentum to them. They don't like big drastic changes. They like little changes over time. That's just more digestible. It is human nature to want to do a big change kind of immediately. And I tell people, like, sometimes I want to rip really fast, like, you know, ridiculous ride that I have no business doing, and I weigh the pros and the cons of like, if I do, will it irritate an injury that I have or like a weak spot that I'm aware of? Or does the other side of it weigh out where it's like, well, I want to spend time outside, I want to spend time with my friends, and like this is the ride that's happening. So I'm going to send it and see what happens, and we'll see, you know, if it was super risky, I might not get away with it. If it wasn't that risky, I might be totally fine. And putting the decision back in the person's hands to like empower them with like how risky it is. So more risk means that like we are hanging out in like the yellow and the red light zone, and we're changing more things like at one time, versus less risk means that like we're in the green light zone and we're doing pretty good. Another example I give to people is like, if you're training for a half marathon and you're out on a training run and you're having like red light pain come up, it's like, why are we experiencing red light pain on a training run? Like, we don't need to like muscle through this. Like, that's crazy. Like, back off, walk, drop your pace way down, like give your body a break. Like, there's no reason to be a hero during a training run. But let's say you're actually in the like half marathon that you've been training for, that you're so excited with. And in my case, let's say you're running it with your younger sister who you're competitive with, and who you want to run it with, but who you also really want to beat at the end of the race. I had some yellow light pain, hip pain that I had not experienced during training, which was a big bummer to come up during the race about halfway through. And as I was going through the race, it kept getting worse. By the end of the race, it was like at a like 7 or an 8. I chose to run through that because I wanted to kick my sister's butt, and because I wanted to like get a good time in this race. But like, that is a very different reason to push into red light pain than like it's a random Tuesday and I'm on like a training run, right? So like, helping people understand like there's reasons why you might like tolerate some of this, but again, the more time you spend here or here, the higher the odds are that there's going to be like a little bit of a bill to pay, you know, later on. Yeah. I was feeling, thank you. She played soccer for UT and is the more athletic sister, so it felt good to meet her. She was pregnant, so we will have to have a rematch, but she is pregnant again, so the rematch is not coming anytime soon. Yeah, I dropped her for like halfway through the race for a little while, and then my hip really started hurting, so then I slowed down, she popped me back up again, and then I toasted her at the end. Which was really fun. And she was not expecting that, which is on her for not reading the situation better. She should have done. Okay. Another thing that's really helpful is as you're talking about volume, one of the best ways to get an accurate picture of what an athlete's actual volume is to tell them to open Strava. Most of you probably know Strava is an app that tracks actually now like all types of working out, but it's for endurance athletes. It mostly tracks like runs and rides, and will show you like a nice map of what you've done, which I really enjoy and most of my friends really enjoy. It's my favorite social media because it's kind of like an actual wholesome version of social media that makes you want to be more active generally. So if you're gonna work with runners and cyclists, you gotta know the interpretation of what these graphs like mean in terms of somebody's activity level, and you also have to be able to like have somebody pull up their Strava and be like, okay, you got hurt when we went. So like, this is somebody who she runs a run club. She's super duper active. 56 miles per week is a like pretty high level of miles per week. It is sustainable for a lot of folks, but anytime we get over like 45 miles per week, it is somebody who is running like quite a bit. And if we're having like big drops, sort of like up and down, it again increases the odds that like things are gonna go kind of sideways. She was also training for, I believe, a full Ironman during this time. So like some of these bumps too, I forget when her race was. Some of these bumps like could be around her race, or the declines could be around her race. But if she's having pain and she comes in and she says, oh, I started having problems again here, it's like, okay, your body didn't appreciate going from like literally nothing to like a 56-mile week. We needed like a train stop in between those two places. Other people, this is somebody else who runs a run club in Austin. 20 miles a week is a like pretty good, like, I get my runs done like consistently, but I'm not like crazy about running right now. So like for a lot of people, getting to around like 20 miles a week can be a really good place to sustain. If you're training for a half marathon, like most people don't go above 20 miles a week unless they're really trying to like do a particularly fast half marathon. But if you're like a novice runner, getting up to 15 to 20 miles a week is a good place to be. It's also a place where like if volume is going to start to cause a problem, you're gonna see that come out around the like 20-mile mark typically. The other person who is on here is one of our physical therapists. This is Zivi Straba. Zivi does not know that I took a screenshot of this, which is fun. But Zivi's primary sport is running. She also lives, but Zivi's a very consistent runner where she, for the most part, is staying in like the 30-mile range. This is a great way to like sustain fitness and to not hurt yourself, essentially. Okay, cool. I also have a good example of cyclists. Okay, one of these is me, actually. The other two are two gals that I ride bikes with. Okay, cyclists talk about time on, so like runners talk about time that they've spent typically in miles. Occasionally they'll do it in an amount of time. They typically talk about miles. Cyclists sometimes will talk about the time they spend on the bike in miles. Sometimes will talk about the time they spend on the bike like in just like hours per week. It's a little bit of difference there. If somebody is like at or above like 10 hours a week of like cycling or of any endurance sport, that's like having a part-time job doing that sport. They're probably pretty serious about it. So this person that's on the bottom, this is one of the ride leaders for Breakfast Club. This is somebody who has a like very high level of fitness and who is like really fast. She's spending in the like 200 range of like riding for the most part. I saw her actually yesterday, and she told me like, oh, I had a really active week last week because it was Memorial Day and because there was just like more time to ride bikes. Her back is a little bit flared up because she'd gone from riding like 200-ish miles, maybe a little bit less, to 265. And like the bump from 200 to 265 was more than what her nervous system was down with. She also spent like 14 hours on the bike last week, which is a lot of time to spend in like one position for a like road cyclist. This other person is not me, I'm this one. This is somebody who rides like a good amount, but whose volume goes like up and down a little bit more. This is me. I'm a cyclist, but I primarily strength train right now. I run or ride like a couple of times per week. I'm very much a like, do a little bit of everything and try to keep up with everyone kind of person. This big spike in my activity was me riding the MS 150, so I rode 160 miles over one weekend. 160 miles in a single weekend was way more than what I had been riding, so that's that big spike. Unfortunately, my body had enough resilience where it wasn't mad about that, but like, if you see a big jagged spike that corresponds with somebody's symptoms, you're starting to ask some questions about that. But big spikes do not always mean symptoms. Depends on what else is going on. Okay, I'm sure that you guys have already talked about how you talk to people really does matter, and trying to use language that like facilitates understanding and healing instead of like harm. Here's some examples of, on the right side are like things that I say or things that I do like quite a bit versus like a contrast on the left side. You can read the left side, but I, instead of saying pain, 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 pain over and over again, I tend to use language that is a little bit less formal on purpose. Sometimes it is to like get a little bit of a laugh or to like lighten the mood a little bit, not because I'm trying to invalidate somebody, but again, I'm trying to just like, we've been in the pain rut for so long already. By the time you're in my office, let's use another word for it. Let's use yucky, icky, spicy, pressure, discomfort. And I'm also going to like ask that person to like describe the pain more. Again, the more creative almost you can get with somebody and kind of breaking them out of their rut, the just better that things go. For some people, you really gotta like celebrate wins and like point out the like progress that they've made. Some people, it's like they've been oriented towards their pain for so long that they won't notice. It's like, I'm treating somebody right now who's came in for knee pain. We started working on some stuff for her knee. I've only seen her, I think, 2 times. And like the 3rd time that I saw her, she was like, well, my knee doesn't really hurt anymore. And actually my runs and my rides feel better, but my back is really bothering me now. And then she's like, she's upset about her back bothering her because she feels like she can't catch a break. So like, obviously I'm going to like empathize with her and like validate that like, it sucks that like the next thing up the chain is like now mad. But like, I'm also telling her that like, I'm a little bit, you know, I would prefer for you to like be having a better time in your body and for this to like, you know, all move forward at the same time. But also the reality is that like sometimes things shift around a little bit. It is easier to deal with something that has like recently come up than something that your body is stuck on. So like, I'm actually okay with your back bothering you a little bit. Again, like we're gonna work on some stuff to make it better, but it tells me that your body isn't so like bound up in your knee and what's going on there that like, you know, we've created a little bit of an open gap for us to kind of move through. So sometimes you gotta point people out, be like, things are changing, don't lose hope. Like, I am your cheerleader as well as your physical therapist. Here's some other things that I tend to say to folks. The last thing I'll point out, it's really easy for people in our world to like want to shame or blame like clients or patients for like not doing what you ask them to do. And like, I totally get that. And depending on like what setting that you're working in, it can be like super duper frustrating that like it's hard to get people to buy in. Your job as a PT, besides being like cheerleader and problem solver and detective, is also to like figure out like what do you need to do to help this person be motivated? Is it possible to get this person motivated to do whatever you're getting them to asking them to do at home? And like, what is standing in their way? And maybe I gave them an exercise that just like, it sounded good, it looked good, but like, it's just not gonna happen at home for whatever combination of reasons. Some people will not get on the floor of their home because they don't like that it's dirty, or they've got a dog who will come and jump on them and they don't want that. So it's like some people, I cannot give them an exercise on the ground, which is a lot of the exercises that I would give, or I have to like help do a little motivational interviewing about like what is getting in your way. Just telling somebody you gotta get your stuff done puts this weird layer of like guilt and shame, and guilt and shame is like a pretty bad like long-term motivator. So really try not to do that with people. Let them know the reality and let them know like, I can give you another option for working on this. We do have to get something done, and like but also like, yeah, try not to just like wag your finger at people and make them feel shameful about not getting things done. A lot of the time I'll tell folks that like some is better than none. So like, hey, you didn't get your exercise done every day this week. You know what? You got it done twice. That's infinitely more than what you were doing like the previous week. I'm gonna take that as a win. We're gonna strive to get better, but also like give yourself a break. Like, don't be so hard on yourself. You're here, we're making progress. Like, don't get down. If you get down, it makes it harder for me to do my job. So don't do that. Bring in a little bit of humor, that also helps. Okay, let's take another little break. I've got a couple more things to go over. We'll be back at 3.
You don't have to wear it. You can wear it. Okay. That is perfect.
It really depends on the person.
We're in a recession over here. You're in the golden era.
It's like,
Thanks,
tell me
Reed.
what I need to do to get this done, but like, I don't really care about something like this related. I think it's too, it's like, everybody's interested to some extent, it's just like, seeing like, how far into the future you go, where it's like, some people I eventually talk to them.
So I want to use this one for like tanning.
Because, of course, just like spend a lot of time in the industry.
Are you bored, or do you need this person? Okay, no, real cool. With mine, like, so high. I get you.
And I'm like,
I have
this
the same.
entire thing right there on my
Yes.
card, like,
It's
it's
like a feeling.
It's like there's a reason why like engineered types are kind of attracted to
It's so cute. I think it's cute. It'll be supportive. I've had one of them. You don't even need to do that supportive, honestly, because
there's a certain type of person who like
wasn't that bad. That's high praise.
that was like they like
Yeah.
and now that whatever you're saying is true, but like yeah, they're on and you can tell they're kind of like questioning and you're like how do I explain this in a way that like I'm explaining it in a way that would make sense to me. They're not getting it, so they're gonna get hung up on this like
Is she like really skinny?
I saw
I haven't seen
like
no, not like this. I just heard that she does. She loves.
Did y'all talk about there's a book that I like to use a lot of time?
Yeah. Because I'm also like, that's $20. Yeah. Exactly.
Yeah, I like, one of the most things does a better job of like, I don't know, connecting to people in a way that like doesn't. Sometimes we can be on parents' side and they just fall into like, you're telling me this is all in my head.
This really knows.
But like the booklet does a pretty why do I pretty good job that I really started and like
Oh, you're talking about the
really great might teach you some new stuff that I'm hoping I can teach you some stuff you don't know. You know, I'm not telling you this is all in your head, but I am telling you that like if I don't help you understand how it works, then like let's say like talk conversations I like really hated metaphorically there was somebody was working with this street like here when I was rotating through there it's like the mom like somebody else in the program and like in school we had been given like this pain sensitization like questionnaire and I had her fill it out and she got like insanely defensive after filling it out and I was just like learning lesson can we change that I won her over eventually
Yeah. Well, that doesn't mean but sort of my oh yeah. But then
we were just talking about how hard cleaning your pen
this looks so nice. Like people then can be like doing your best to the person after walking.
it's all in my head
I usually do
Right away? Yeah.
He's not even
In like
Don't dap him up, we're encouraging behavior.
Your feedback for every class.
Even worse. Yeah. And like this woman was like, her foot pain was like so bad that like she wasn't gonna be able to go to. She had some job in Austin during the like regular, but in the summer she would just go like raft and like raft guide for the whole summer. And she like couldn't wear the sandals that she needed to wear for that because her like foot really hurt. And like the way she had some deficits for sure, but she also had like a cluster of things that made me think that she was like super sensitized. And I was up front with everything. I was like, hey, your pain is complicated. It's been around for a while. It's also like really directly related to something that's super important to you, which makes it like even more of a delicate balance of us trying to find the right things. I think it's worth a shot. I think this foundation, like exercises, like having the chance of figuring out. But I also want to acknowledge that like it's not like a straightforward thing, and like our timeline is like compressed because of like like the leave. And we got a few sections in, and I gave them like full spiel that I give before I give somebody. I give people to like why do I hurt for them to read just like a primer on neuroscience education, but like you can't just passively give somebody something like that. You have to be like, oh yeah, you know, this is hard to talk about or tricky to talk about, not because it's like a sensitive topic. It's literally why you're here. But like, look, there's some really good research, like our understanding yeah, my brand is how is that?
oh, you just ran 7 miles?
More than understand about
When I worked oh, last semester. I was just like
navigate out of like these into like this and
say all of that, just sometimes like, if people say all of that, they come back and say, you're telling me, the pen was fine. I'm so sure that it would be wrong of me to not also help you like understand this piece. Like last minute, I told you now I can only handle this because of like what I do. But I also want you to do this. I thought really like, and she was like, yeah, I would love you. And she came back, but like, she sat down and talked to me and like, her eyes and then she was just like, I like, I think this is all I did. And I was like, no. I want you to
Yeah, I remember you telling me. Why? You're Philippines people, right? And the weather. No, the weather's worse over there.
It is so and it's like no longer yeah, like there's tornadoes.
Tornado? There's tornadoes?
Yeah. Yeah. Every once in a while. You know,
yeah, and I'm going to Rehab.
had to get flood insurance. Some money. But they do have a lot of dollars.
Graduated from life.
We can only afford 75 cents per share, but we're equal equity holders.
But it's a great.
I say that now. Did you guys see
Oh my god, are you okay?
the injury that hurt so bad?
No, not the other hip now.
We have a different.
What I was thinking was that important stuff. Actually, they make hot Cheetos that taste exactly. It's so bad. They're making Cheetos that have no dye. They're white, and they taste the same. I had it yesterday. They're called the Cheetos.
No, I was thinking about this and I was like, my dad is probably so happy right now. But it should.
Well, if I do, you're going to be creepy,
They're like 1 day a week.
I'm ready.
When they're old, they want to take care of themselves.
So true. That's crazy.
See, I said that to my brother, and like,
Yeah. It was like, they stink.
saturated fat. Just like every, I'll watch them.
I believe so.
I don't remember. It's like something that like
It's like the first thing I'm personally no eating whatever you want. You can go to soccer practice. They won't do their HEPs, and I'm sure I'm going to get them.
I don't know if I'm those, but I like those two. I just feel don't think that would make sense.
Yeah, wouldn't that be so nice? Just like a 5 p.m. errand.
I say that when like at the gym. Oh, yeah.
She'll make a snack for them
Alright, fair enough.
after
Yeah,
she
right.
gets home.
I say classes when I'm eating.
What about like every
That's it.
It's like if there were 2 people that did every other type, and then they could trade with each other.
If I open up practice the game higher responsibility. What? I'll get them by the end of next week.
That's on Thursday.
Yeah.
Because it is going to be fresh meats at the first
So
week.
cute.
A whole lot of running.
Like I was really talking about my first
We're barely meeting with Dr. Card.
Alright, y'all ready? I got lost in the sauce and Irene's question. Irene wanted to know about like self-talk work, like, hey, when should you tell people to like do that type of work? Is it before the thing that bothers them? So like Irene is like, hey, my hip pain comes up if I've run like around like 3 miles. It starts to pop up like actually on the run. It doesn't get worse after that, but it kind of sticks around. Should I try the lacrosse ball, and like when should I try it? So a lot of the time I'm having people try something like soft tissue work or an activation exercise before riding or running to see if we can get some data on like what happens. So like if I told Irene, hey, try a little bit of soft tissue work before you go run on those spots that were tender. If it increases the amount of time that you can run before, or the amount of distance you can run before your problem comes up, great, keep working on that. That's awesome. That's not the only thing that you're gonna do, but that is part of it. If it's like, hey, I try that, and I have some tender spots on that side that are different from the other side, but it doesn't really affect the run right away, I would still do soft tissue work on that spot. I just wouldn't make a big deal about it being right before the run. I would be then iterating through other like techniques to try or like exercises to try to see if I can find something that like lengthens out the amount of time that you can run while you're also working on other exercises and other things that are going to help, you know, move you forward. Does that all make sense? Sweet. Okay. Okay. Another thing that I draw for people a lot is this thing that I call the mountain. I think out of all of these, I think the mountain is like from my own brain. I don't think that I took it from somebody else. I think I was just like, I need a way to like explain this concept to people. And the concept is like, sometimes people are surprised when they like run more or they ride more or they do whatever more than what they've been doing before, and they have like an injury pop up and they're like, gasp, an injury, or like my body kind of letting me know. And this is a way to tell people like what I said earlier, which is that like endurance athletes and a lot of other athletes are always going to try to find the edge or the limit of what they can do. They're going to go until something stops them. The question is, what is going to be the thing that stops them? So I draw this picture of a mountain for people, and I say at the top of the mountain is like the most that you could physically do on like one day for whatever activity that you want to talk about. And then I say, there's a line lower down this mountain, and I draw a little dashed line, and I draw a little tree, and I'm like, it's the tree line, because most people know what a mountain looks like, where it goes from like trees to like not trees. And I say, the tree line is how much you can do before you find whatever your current weak link in the chain is, which, you know, for you is your knee, because if you try to run more than, or your hip, because if you try to run more than 3 miles, that starts to come up. And then I tell them, the goal of PT is to move this line up and up and up the mountain. And I tell people, if we're doing strength training, for example, I tell people this substantially moves the line up. Like strength training helps move this line up. And like, you know, it changes. Your mountain changes every day, right? So like, over time, the goal is to move you like higher and higher up. But like, if you don't sleep very well the night before you have like a big run or a big ride, the line like starts to creep back down the mountain again, right? We're gonna find the weak link in the chain like sooner. So this is telling people like, if you send it, like it's essentially like fuck around and find out. If you fuck around hard enough, you're gonna find out. And letting people know that in a clinical way is a good idea. Another thing that I use a lot of times to like help people understand is this like circle drawing. I did take this directly from another PT. This is just another way to explain to people like essentially what I explained earlier of like incomplete mechanics. So it's like this circle represents like how much that you could currently do, like how far that you could currently run, and like you've got a hole in the middle of your circle because you've got some like movement inefficiency or like increased tension or like decreased, you know, like range of motion that's impacting you. So like PT's first goal is to like fill in that hole with like exercise and manual therapy that are going to help you out. After that, PT in the like second phase and the third phase for us, so this is the reset phase, the restore and the fortify phase. The goal is to make your circle bigger, so that you've got more capacity to do these like bigger, you know, activities that you want to be able to do. Again, seems really basic, but like the more real that you can make things for people, the better. This is something that I sometimes use for people. Again, I had ChatGPT make me a really quick thing, so if it's kind of weird, that is that, but it was more engaging than just putting the like words on here. But usually I tell people like, okay, my goal is to get you to a place where like you're moving well, you're in less pain, and you don't have to think about it that much. But to get you to that place, there's gonna be this big middle ground phase where like you're gonna think about it, about how you're moving a lot, and that is just part of like physical therapy and part of like bringing you into your body and helping like the brain-body connection. So when you first come into PT, you are unconsciously incompetent, which means that you've got, again, some funky ways that you move, and you didn't even know that they were funky until, or you might have had some idea, but for the most part, you didn't know. That's why you came to see me, so that I could make you consciously incompetent, which means you now know that you've got some like limitations in the way that you move, you're aware of them, but we're not to a point where we're like actually correcting those things yet. Then we move you over to conscious competence, meaning if you think about it, you can do a rear foot elevated split squat pretty well, or whatever it is. And eventually I wanna, again, move you to a place where like, you don't have to think about the way that your foot hits the ground every time that like your foot hits the ground as you're running. You don't have to think about everything in the gym, but the way to get to unconscious competence is to think about things a lot, and is to spend all that time. I use this one honestly less than what I used to, but it's another good way of like helping people understand motor learning, essentially. The other thing that I mentioned earlier, the guy that we had interviewed yesterday didn't have like a structured plan of like how to get somebody back to running. This is a resource that I like. It's really small on the screen, but hopefully you can see it better on your computer. I wanted to give you the whole thing instead of just part of it. One of the educational sort of things that I've done that I've really liked has been a program through Gait Happens. And Gait Happens has this like return to run sheet that I use a lot with people. So if somebody has not been running or is new to running and wants to get into running, I walk them through this sheet. The way that I use this sheet, I tell folks that like you're gonna start and end every run with a 5-minute walk as a warm-up. Do not skip on that. And then this program is gentle enough that you could choose to run 5 days per week if you wanted to, which is really nice for somebody who's getting eager to get back to things. I tell folks, you do not have to run 5 times a week. A lot of people that I use this with, like, I'm like, hey, for week 1, pick 2 of the runs. So pick 1 minute walk, 1 minute run times 4 and times 6. Do not run back-to-back days. Get both of those done before the next time that you come in, so that we have some like data to work off of. If that goes well, if like walk run for 1 minute each times 4 and times 6 goes well, then we're gonna move to week 2, and so on and so forth. If it does not go well, i.e. like symptoms come up during, after, or like the next day, then we're probably gonna hang out at like week 2 or like whatever week that you're having a problem with, or like right before that, essentially, to like help build up some volume. I tell people too, it's super boring and like anticlimactic to like be on week 1 or even week 2 because it's not that much continuous running. Deal with it. It's like everybody wants to just like go back to running and run a 5K immediately. A 5K is like 30-ish minutes of running. It's just not reasonable to expect your body to go from like 0 minutes of doing something to 30 minutes. And some people are like, well, it's not even worth it if I can't like run a mile. And I'm like, okay, don't have me go about it. Be chill. Don't post it on your Strava if you don't want to. But like, you know, this is the path that's gotten a lot of people back to running, and we're gonna have to do part of this path of walk jogging, and that's just, you know, what it's gonna be. Or you can ignore me, and once again, you might find out something later that I was right, that you really should have listened to me. Sometimes you do have to body your people a little bit, in good taste. Okay. I mentioned this earlier, we're moving into the exercise portion of this. We've got like 1,000 videos on YouTube, 1,100, most of them are exercises. There's a couple that are not, but I have a huge exercise library that is like in my brain that's taking me a lot of time to build out. My goal is not to like match your exercise library to mine. My goal is to like give you some new exercises and like some cues and refinements on the other ones to expand your like exercise library a little bit. A lot of what you're going to do on clinicals and afterward is build out your exercise library, and you're going to build out things that like you really like for certain types of people, and it's going to be great. But I'm not going to pretend that I came out of school with a great exercise library or that like it wasn't a struggle, because it is a struggle, and I wish. My biggest critique was that I wish I would have learned more like exercise in school, especially strength training, because I didn't get that much of it, and had to do a lot of that on my own. Okay, the first box, neuromuscular motor control exercise. Why not just put weights in people's hands? There's a lot of PTs, especially like Instagram PTs, who are like, you just gotta get your people strong. Like, just put weights in people's hands and on their backs. And like, again, I think there's a time and a place for that, but I also think that like for my specific like client population, a lot of people who struggle to get out of pain, a lot of people have already tried weightlifting to some extent, and like me doing these exercises is helping to like regulate the nervous system in a lower stakes environment and promote a proper response to muscle contraction and movement. So for a knee that's like super sensitive to squatting, it's possible that you can regress a version of a squat enough that the person is able to like squat successfully. It's also possible that that person's body is going to be like, I don't like that, I don't like that, I don't like that, in a like gravity sort of dependent or a regular gravity position, and that you might have to do something kind of creative to get the body to be, and the nervous system to be okay with like the knee bending, for example, or switch things up. So novelty is a big part of this. It helps decrease pain, increase your chances of success. You also, strength training can work on range of motion and asymmetries, depending on what you pick. These exercises also give you the opportunity to work on like range of motion, muscle imbalances, and asymmetries in a different way. So I do think they are valuable. For somebody who's worked with me for like a long enough amount of time that we've kind of like worked through a whole program, I've worked them up to like a strength training program that looks like conventional gym lifting or somewhat conventional gym lifting. My take on what that should be for a runner or cyclist, whoever that person is. They've got a mix of things at that point. So they've got like some soft tissue work to do. Maybe I do some of that for them while they're in clinic. They've gotten a ton of education. They probably still have at least one or two of these type of exercises. They've got a good chunk of strength exercises, and they've got some plyos as well, for somebody that worked kind of all the way through this process. I've also given them some education on like, hey, if your body starts to like chit chat with you that things are coming back, the first thing you're going to do is like this calm down exercise, this calm down soft tissue, and let me know, how that goes. Again, this is an insanely huge category. There are like some PTs who like only do this type of exercise and like not the other stuff. I'm again telling you what my specific preferences are. It's also really hard to, I know that like especially in school, you're super big on like evidence-based practice. There's no meta-analysis that like goes over these exercises, right? Like everybody is so individual, and we have jobs because it is really complex. You do have to use like your own clinical decision-making process to decide what you're going to do, and like you are going to be biased into liking certain types of exercises more for certain people. Bias is good in this case, right? Like it helps you like actually have opinions and like make decisions. So my specific preferences for this style of exercise are postural restoration suit exercises. They're low level, they help calm things down at the beginning. I really like isometrics. Isometrics a lot of time are like a nice thing for the nervous system, because instead of dealing with like all of this movement, we're just like dealing with a sustained muscle contraction and seeing if we can make that feel okay. I like range of motion work. I'll give you an example of that in a moment. I really like muscle co-contraction. So getting, for example, the calf and the hamstring and a little bit of glute maybe to fire at the same time. Getting like the quad and the glute and a bunch of other things to fire at the same time. And a lot of these things get combined a little bit. So it's like I'm doing an ISO that also involves like multiple muscles co-contracting around a joint that we're having a problem with. For example, for a knee that's like pretty irritated in like the front of the knee, a lot of the time doing muscle co-contraction of the hamstring and the calf together is awesome, because it pulls somebody out of like over-dominance of like the quad muscle being really tense and kind of like yanking on the front of the knee, and redistributes sort of like tension into the back of their knee, gets them a little bit better balance. So I love the femoral bridge for a lot of things. We're gonna go over that in a little bit, but that's an example of muscle co-contraction. This is also exploring and improving movement options. So some of these like aren't the most like functional carryover, but again, you might have a good reason why you're doing some funky exercise again to like help somebody's nervous system be down with like change and whatever you're like asking for. This is a PRI exercise. It's probably the most popular PRI exercise. We are going to go over it. A lot of people's bodies like this. There are a chunk of people's bodies who do not appreciate this for a lot of reasons that I'll probably get into a little bit while I'm explaining it because we're going to practice some of these. But this is called a 90-90 hip lift. I just said this exercise is art and science, or like exercise selection is art and science together, especially at the beginning. And you don't have to like do this for every single exercise. You don't have to have a test retest for every single exercise, but in general, if you're trying to suss things out and figure out like, why is this working, you should have a reason for why you're doing like each exercise that you're doing. That's probably been eaten into at this point. And it's nice if you have a like test retest for at least like part of the things that you're doing so that you can figure out like, hey, I thought that like their range of motion needs to be better on this joint. I did this exercise because I thought it would improve it. I check it and improved it. Yay, keep going. No, it didn't improve it. Ooh, like do something else. Or if somebody has back pain and they've got like limited rotation sort of range of motion, or it's painful if they rotate in one direction. Let's say I do an exercise that I think is going to improve that. I have them move their spine again. It got better. Great. That's awesome buy-in for the client. If it doesn't get better, you get more information, which is really exposing and like puts you on the spot, but makes you a better PT to know like, did the thing that I tried to do actually change the thing that I was actually trying to change? And do I care about that changing? If I do, you know, what can I do to get that to change? It's also helpful to like have in your brain, so instead of just like a catalog of exercises for like each body part or for like different things, it's also helpful to have like in your brain or like written down even like an organized flow chart of like a squat. If somebody has trouble with a squat, what's a way to make a squat easier? What's a way to make a squat harder? What's a way to like modify a squat that biases it more towards this motion or that motion? There needs to be like a little like graph of things in your brain because like if you try to do a split squat and it doesn't go well, you need like a regress version. If that doesn't go well, you know, you get to decide on if you're going to keep trying to do that or if you know you've reached the end of kind of like how you can regress that. But exercise is data collection, so it is really helpful if like you work in a setting where you actually get to do exercise with people, because otherwise like you're kind of flying blind just having like a tech like do stuff for you and wondering if like, well, I hope that did what it needed to do for that person. Okay, we're gonna practice. We're gonna do the isometric one first because it's probably like the simplest to understand, and then we'll kind of work through those as we go. So if you afterwards want to go back through and like try some of these exercises, all of these are like links to our YouTube that should work. If you find one that doesn't work, you're welcome to email me and let me know. And I tried to pick ones that were decent videos of us like at least doing a tiny bit of explanation. Okay, so let's have everybody stand up because you're all going to get to experience your body. Okay. Raise your hand if you've done some version of a split squat before. Okay, yay, most people. A lot of the time, so one of my other beefs with exercise is that like a bunch of things have the same name, and so a split squat is very similar to a lunge. A lunge is essentially kind of like a moving version of a split squat. I really like a split squat for a lot of people, and it's one of my like non-negotiable exercises for like a runner or a cyclist, just because it helps the pelvis move like up and down. And I'll talk about that a little bit more in the strength training portion. But I love a like version of a squat iso for somebody with knee pain. We're gonna do a split squat with an elevator hold. So this would be perfect for somebody who I can do a regular double leg squat, that's going well, but like if I try to get in a split squat, when I get to maybe like right here, there's like some pain and some discomfort at the front of my knee, and like, you know, Amy, you think I need to do this exercise, and you know, I'm like, yes, the split squat is good, you should be able to do a split squat. It's like, how do we help the body desensitize, and how do we help get things figured out? So in the case that like, let's say you got somebody with knee pain and a split squat around like 90 degrees of knee flexion for the front leg, what I would do is I would stop essentially like right above where the like discomfort comes up, and I would hold. It is not a crazy concept. If I'm going to cue all of you through how to do a split squat, at least the way that I would like one done for this right now, you go 1 foot forward, 1 foot back. The front foot is flat. The back foot, your heel is up. There's a variety of like how far forward or back your foot can go. That can be right. It kind of just depends on what's going on and how the person feels about the motion. I want your weight roughly 50-50 between the front leg and the back leg. From here, I'm looking for your rib cage and your pelvis to be like an elevator. So what I don't want is a big lean forward. This is an okay motion. It's just not what I want out of this particular motion. So sometimes I'll have people put their hands on their chest and on their belly, or even like look at themselves from the side in a mirror. And I tell them I want you to go straight down. And then if you have pain around 90 degrees, you're going to pause right above that, and we're going to hold. As you hold, you're just going to keep the intention of putting pressure through your feet, through the floor. So like that front leg, you're keeping that whole foot pressing to the ground. The back leg, you're pressing through the ball of your foot and through that big toe. And I usually have people hold for around 30 seconds, but the big thing I'm telling them is make it suck. So like, I want you to feel your quad actually starting to like fatigue out. You might feel the back quad more because that quad is on stretch, right? Either one of those are fine. When you feel like that's about what your body wants and you're starting to fatigue out, you can go ahead and come out of it. The cue is like, make it suck, and then, take a little break and chill. If it didn't suck yet, you can hang out longer. But yeah, really simple way to, again, modulate the nervous system, get a little bit of load on the quad, introduce people to something that eventually is going to turn into something else. Questions on that split squat with an elevator hold? If you did that and it went well, and you had somebody work on it for a week, and it's like, okay, cool, let's do it again, or let's like progress it, you could have them elevator through, tell them essentially like there's different, I want you to go to different floors on the elevator. So like, this is the top floor, hold that for 10 seconds. This is the like middle floor, hold that for 10 seconds. This is the bottom floor, hold that for 10 seconds. A lot of time doing the holds along a range that has previously been painful, again, helps desensitize the motion, helps like just the body understand like, okay, cool, we can do this without it being a big deal. Okay, we're gonna do the 90-90 hip lift next. The 90-90 hip lift is the funkiest for setup because you do have to be on the actual ground. So what we're gonna do is we're gonna put our feet on the wall. Whoever takes care of this room would probably appreciate it if you took your shoes off so that you don't smudge up the walls. So I know it's a big ask, but let's have everybody go ahead and on the wall. I know it's like not. I know probably most people are gonna like default keep their socks on. Your socks are sitting on the wall. You do need to take your socks off. The dogs have to be like all the way out. I know. But usually I have people just keep their shoes on. But I don't. This is not my clinic. This is Texas State. Okay. As you're setting up, your hips and your knees both need to be at about a 90-degree angle. It's really easy for people to be a little bit too far away from the wall for this, so make sure you're about at 90-90. If you ignored me and kept your socks on, that's fine. But if you don't feel what I'm asking you to feel in a moment, maybe you'll take your socks off then, or maybe not. Okay. What is 90-90 hip lift doing? 90-90 hip lift is putting by essentially you being in this position, your pelvis is in a neutral position, right? You're not anteriorly tipped, you're not posteriorly tipped, you're kind of about in the middle of things. What we're gonna ask for is we're gonna ask for essentially like a low level hamstring contraction to help reinforce that neutral pelvis position. A lot of times if you have low back pain or like hip pain or knee pain, this could be a low level nervous system calm down exercise I might use because the hamstrings are really helpful. If you were a person with low back pain and you were doing this, I would say your low back is probably overactive. I found a lot of muscle tension there. This exercise helps your hamstrings know that they can help control the position of your pelvis in conjunction with your low back instead of your low back taking over and doing too much. Again, This is not a crazy sensation exercise. This is not a make it suck one. This is more of a chill one. Okay, so the other thing, if we were doing this for real, and I had enough supplies, there would be a little ball between your knees, like there is in that picture. I'm not gonna try to find a bunch of balls in the closet, and I don't want you to put your hands there. I want you to put an imaginary ball in between your knees. So I want you to create a tiny bit of tension of your knees toward each other, like a 2 or a 3 out of 10, not like a crazy amount. I don't want you to actually put anything there because that might make it weird. Okay, from here, you're going to connect your brain to your feet, feel your feet flat on the wall, and I want you to imagine you are especially like rooted through the wall through your heels. Once you've got the heels, and once you've got your brain on your heels, you're going to pull your feet down towards the ground without actually moving them, so they're going to stay in the same spot on the wall, to scoop your tailbone off of the table or off the ground, and float your tailbone just above the ground. After you do that, your tailbone's just barely floating off of the ground. You're really going to try to make sure you can still feel your heels. For some of you, you're going to feel the backs of your legs, your hamstrings holding you in this position. For others of you, you're probably going to feel your low back. And if you're feeling your low back and I were working with you one-on-one, I would cue you out of it. And I'm going to give you some of the cues to see if you can get that. But some people are going to feel their low back on this one. And if I can't cue you out of it, then this just might not be the best place for us to start. But it's, depending on what's going on, I might think this is worth a go. Instead of doing reps here, we're going to use breathing as the reps. So as your tailbone is floating off the ground, you're going to take a big breath in through your nose, nice quiet inhale, and you're going to take a big breath out through your mouth as you're blowing up a balloon and get all your air out as you do that. I want you to find the bottom of your exhale, so much so that if you took a bigger exhale, you might cough a little bit. You're going to take, I appreciate that noise. You're going to take another inhale, nice, gentle, easy. Big exhale, loud. And as you're doing that, you're still really trying to stay heavy into your heels. You're keeping that imaginary ball just a little squeeze in between your knees. You're feeling your ribcage melt down towards the ground as you take those big exhales. You're hopefully not being shy about breathing loud and taking big exhales. If you are still really feeling your back, or if you're feeling your calves, I want you to imagine there's a seesaw between your knee and your foot. Without actually moving, just by kind of like changing the pressure on the seesaw, I want you to dig your heels down and your knees up, kind of at the same time. Again, imagining there's a little balance on the seesaw. Your whole foot needs to stay flat, so if you're doing something weird, lifting your foot off the wall, you're missing the quad, stay a little bit. Okay, you've been up for a while. Go ahead and put your butts back on the ground. Okay, that was 90-90 hip lift. Hands up, or maybe actually feet up off the wall if you felt your hamstring. Okay, raise your foot in the air because I can't see hands if you felt your hamstrings. Okay, nice. So some of you, raise your feet up if you felt something else. Hamstrings and something else. That's also a good answer. So some of you as well. So again, there's reasons why I would pick this. There's also reasons why I might skip this at first. Kind of just depends on the person. If you felt your hamstrings like relatively cleanly, I might be excited about this for you. Again, if I thought that like you needed some nervous system calm down work, if I had tested your hip extension and it was limited, this can actually really help improve hip extension. If I think your back muscles are overactive and I need something else to, again, contribute to where your pelvis is in space, this could be an exercise that I choose. There's some people who their nervous systems and their bodies and their brains really do not like this type of exercise that is like very slow, very like, ooh, is it happening or not? You kind of got to grade the exercise for the person. So there's some people I wouldn't do this with, or I would change my mind on after we try it. There's other people who like love an exercise like this and who it is like super helpful. Question.
Does it matter if we feel more distal hamstrings or proximal hamstrings?
Great question. The PRI nerds would say that feeling your proximal hamstring is ideal. If I were going to get into this and really cue it with you, probably on the first round, I wouldn't do it that much differently than what I did this first time. But on like the second or the third round, if I can tell that like you're chill and this exercise isn't freaking you out, I would say, can you feel your like kind of higher up hamstring, like the one kind of like closer to where your butt is? If you can kind of shift around a little bit or shift your weight to like emphasize that part of your hamstring, go go ahead and do that and kind of reinforce that. Any other questions?
So for improving
Yeah.
hip extension, do we want proximal hamstrings?
I have retested this on people where, like, even if they're not getting proximal hamstring, it can make hip extension better. This is also not like, it doesn't have a 100% batting rate where, like, it doesn't always improve hip extension. It depends on the person, unfortunately. There's some other exercises that this is one of the exercises if I'm trying to prove hip extension that I would use. There's other exercises that I might also iterate through if this one, like, doesn't do what I wanted it to do. Does that make sense? Cool, okay. Any other questions on this one? Yeah.
So I felt it mostly in my hamstring, but then I was starting to get quad.
You're starting to get quad a little bit. Yeah, that sometimes happens. I would adjust your position. So some people, instead of being 90-90, being closer to 60-60 is a good position. You might have just been up in that position for a long time because on the setup it took me a long time. Typically, once somebody's all set up, I'm having them do 5 big long breaths and doing like a ton more than that. We'll sometimes have some other stuff kick in and try to help out. So I might shift a little bit. Yeah.
If you're getting like nerve-related symptoms down your leg, would you just recommend like stop completely?
Nerve-related symptoms mean this is not the one for you. That something else needs to be different. Yeah. I would not. This is not. If there's pain on this one, it's not your guy. Yeah.
So could we, if somebody was doing like glute bridges and that was whenever they were having like a low back pain and you weren't able to stop them through getting,
Yeah.
yeah, this would be like a regression for that kind of?
It could, yeah. It's possible that their body might still not appreciate this, but if someone was doing a glute bridge and it was bothering them, I would definitely try this and see if I could like shift it a little bit. They're gonna want to launch their butt up in the air like they just did on a glute bridge. The trick here is keeping them nice and low. Okay, we are actually gonna flow into another exercise that is in the same 90-90 supine position. So I'm actually gonna have you go ahead and pop back into that position. Don't lift your butt off the ground quite yet. This next exercise is called knee rolls. So knee rolls essentially was made up by a guy who was like riffing off of like postural restoration exercises and concepts to like start to bridge the gap into more movement and something more interesting. His name is David Gray. I'm a huge fan of like him and his programs. I've got a link to his stuff at the end here. But knee rolls are what we're gonna do next. So you're gonna put your feet back on the wall in that 99 position. You're gonna connect your brain to your heels again. You're gonna do that little scoop of your tailbone off of the ground to get your butt off the ground. If, actually put your butt on the ground just for a moment again. If this one didn't go well for you, i.e. you had like nerve symptoms or something else funky, you're gonna come sit down and do this one in a chair instead of doing this one on the wall because knee rolls can also be done sitting. They're better in my opinion. If you can do them in this supine 90-90, then my preference is to do them in supine 90-90. Okay, feet back on the wall, tailbone lifted up, scooping that tailbone off the ground, making sure you can feel a little bit of the back of your legs working. You're gonna have that imaginary ball still in between your knees. From here, what you're gonna do is you're gonna roll one of your knees up towards the ceiling while you pull one of your knees back towards your hip socket. As you, yeah, I should have shown you this one. Okay, everybody look up and look at the screen. Okay, hop up. Okay, look. Do you see how one of my knees is more forward in space, more like anterior versus the other knee is more like posterior now? You imagine there's little lines on your knees. One knee goes forward, one knee goes backward, and you roll back and forth like that. Again, this is a lot easier if you have a ball in between your knees. Your imaginary ball is going to make this harder, but it's this amount of movement. It's not windshield wiper knees. It is one thigh goes up, one thigh goes back. Does that make more sense? Yeah. So it's not a side.
Something got water.
I can't do it on my left.
Okay, a weird or difficult motion Your kneecaps should be towards the ceiling the whole time. They shouldn't be swiveling off to the sides. Is the great way to do this. It's not a whole lot of motion. What you are doing here is you are using your thigh bone to your femur. You can tell that I really try to bring it down with clients. You're using your femur to push your hip backwards a little bit and to essentially like get a little bit of movement at your SI joint is what's happening. A tiny bit of movement. You're using your hamstrings and your adductors to do that. This helps disrupt low back tension, helps kind of like butter the hips up if I'm speaking super informally. Anybody want me to, and for you sitting here, do you have a water bottle? That water bottle.
Yeah, you're 90. You're too young. I can't. Yeah, I'm trying to figure
Anybody need me to come look at what they're doing or have a question about this one? Yeah.
General back row, I think.
Yeah, I'll check the back row.
Yeah.
You can also put a water bottle in between your knees. That actually is a decent thing to put in between your knees. Okay, show me what you're doing. Nice. Not a lot. You're, I don't know your name, who's right in front of me, and in shirt, Justin? Justin, that looks good. Show me. Yeah, show me. Yeah, that's good. Cool.
Yeah, I cannot get it.
The ball would make me
You said that?
Yeah. I did them right before class.
Give me just a moment.
Yeah. And then he was gonna hit the 8th. Love Island day 1.
If you're really struggling, raise your hand. I'm going to give you a ball. These balls are too big, but it will probably make this make more sense. Okay, incoming. Incoming. Okay, little squeeze. Here's how to get this movement's hard for a lot of people. Okay, so your butt's really off the ground, and then you're really gonna try to move this up towards the ceiling. That's yes, yep. And then you're gonna move the opposite direction. Okay, so some people just have less motion on this than other people do. This is a movement that just which is totally okay. No. Does it bother you or is it okay?
No, it's fine. I feel like I can't do it. And that bothers me. I don't know.
I feel like one side's easier to use than the other.
Yeah, the right side for sure is.
The right side looks like
Yeah, like that one versus that one. Right, yeah.
Yeah. This might have some stiffness around the left side that makes this hard. This should be a good exercise too. Not a whole lot's happening. You're still working, doing. Anybody else? Yeah. Yeah. This is I'm stiff around my hips, I'm stiff around my SI joint or SI joints, I'm stiff around my low back, and I need to get things moving. This also, this movement of moving one of your essentially femurs back while the other goes forward is called a hip shift. Hip shifts can be really helpful. What happens while we're running and while we're walking is a small version of a hip shift where essentially our hip rotates both into and out of, or our pelvis rotates into and out of where our femur is. For a lot of people who have lost that rotational motion or who that motion just isn't happening well for, doing something more exaggerated like a knee roll or some other exercises that involve a hip shift can be incredibly helpful. It's just a really weird concept to teach people. This version of this exercise, a knee roll, teaches a hip shift in a way where you will know and the client will know if they're doing something weird. If their knees are windshield wipering or if they're really kind of moving through more of their body than just their femurs, you're gonna be able to see it, which is helpful because there's versions of a hip shift that you can do on top of a split squat. It's harder to tell if somebody's compensating in that. So if you taught them this in one way, it's it's easier to help them understand how to bring this hip shift movement into like other motions. Yes.
I was having some tension in my hips, so I'm not sure.
Yeah, sometimes this one can also cause some pinching. Pinching, that sensation specifically, is not a sensation that I really ever cue people to like move through. It's a context clue that like, okay, for some reason there's like a pinching sensation coming up, your body doesn't appreciate what's happening, we would do something else. If you had like pinching during a certain range of this, I would have you do the motion to like just short of where the pinching is, and then I would be thinking in my head, okay, like, what's causing the hip to pinch, what else is going on? I can also look at you, would also look at you to see like, okay, you know, what are the mechanics of like how this is actually happening? Where does the pinch happen? Where does the pinch happen?
What's the three starting up?
Yeah, and it could also just be on the down there part, yeah. It could also be that way about as much as what you want to This is not a like create a ton of tension exercise. This is more of a like you're moving, you're rolling through it. So like you don't have to cram it to the end ranges on this one to get what you want done. Any other questions on knee rolls? You can also do seated knee rolls. Seated knee rolls are actually my like #1 favorite exercise for people with like hip, low back, or knee pain who are gonna like be on a long car ride or be on a long plane ride, just because it like again replicates part of the motion that helps when we're walking and can just like disrupt the muscle tension that comes from like having to sit in a really small kind of enclosed space. To cue people to do that in sitting, I usually show them it this way first, then have them sit. You can put a water bottle in between your knees that you probably have on the plane, and you're doing that same thing. One knee goes forward, one knee goes backwards, just kind of moving, rolling, getting things, you know, popping. Anybody else? Question? Yes.
Would you recommend this like as a warm-up or something?
Yeah. This is also a really good warm-up. It can also be a decent cool down. So I'll talk about this a little bit later, but there's certain types of lifting, powerlifting, that like overemphasize the use of somebody's like back extensors. So like if you go to the gym and you do like a bench press where like your back is like really locked out, and you also do like a back squat where again your back is more an extension, and you do more exercises that bias extension, that can cause the back muscles to become really developed and to just like, you know, leave the person in more of an extended state that would be more compressed to the back of their pelvis. Knee rolls are something you could use to like help the person's body come out of like back extensor like power lifting mode and back into like normal person like walking around mode. Does that make sense? Yeah, cool. Okay, neat. I don't remember what other exercise are on my list. Let me see. Foam roller bridge. Okay, let's do foam roller bridge, and maybe one more, and then we can take a little break. Okay, foam roller bridge. We need foam rollers. We've got some weird half ones, which is not really what I want, but we can make it work. Okay. This is all y'all got? Alright. There's a state. Okay. Let me show you. I'm gonna have everybody stick their heads up and look at either the front or one of the TVs so you can look at the setup of the foam roller bridge.
Really? You're not comfortable with having dogs on?
I mean, I'm very comfortable, but.
Okay, so we're using a foam roller for not what it was intended for. We have some half foam rollers. Half foam rollers are not as good as like an actual round one. The actual round one will like roll a little bit. That is actually good. So foam roller bridge is an exercise. There's some different versions of it. I'm going to cue through a version that first is focused on hamstrings, and then through a version that focuses more on your like calves and hamstrings together. This is one of my favorite exercises. It can be helpful for like hip pain, knee pain, low back pain, a bunch of different things going on. It also teaches somebody's like whole posterior chain of their leg to contract all together if you're doing the calf and the hamstring version. I really love this exercise. So we don't have enough foam rollers for everybody to get their legs on or their feet on a foam roller. You can also do a version of this with your feet just on the ground, or if we have like a block or like a book, or even your backpack, you can get your feet up. The reason why a foam roller is nice is because the foam roller will try to get away from you and try to roll like farther away from your body. And like, what is one of the actions of the hamstrings? Knee flexion, right? So it forces you to keep your hamstrings on because that foam roller, if you don't keep that knee flexion action going, it will try to like get away from you. Okay, let's have everybody get on the ground. We can distribute the like half foam rollers that we have, probably to people on this side of the room. And then I'm gonna cue you through the heels version first. If you do not have a foam roller, let's get your feet either just on the ground, or if you want to put your feet on your backpack. Wow.
Could we also
honestly, these are long. We could get at least 2 people per foam roller.
Can we also use the bottom rack on the stools?
Yeah.
Right here.
Yeah. You could also use the bottom rack on the stools. That's a good idea. Yeah. So let's. I love the creativity.
Well, damn. Someone else will do that.
Here, Myra's, I'll share it with you.
You look so excited for
I'm so excited.
He needs me.
Okay.
No, I'm just thinking about a different.
We can also kind of iterate through this and take turns. This is one that you are going to feel a little bit more. Okay, so set up for this. You're gonna lie down on your back. Your knees are gonna be a little bit bent. The farther the foam roller is away from you on this one, the harder it is. So I recommend starting not like super close to you, but like relatively close to you, closer to what y'all are up the back right now. Anthony has the ball of his foot or his midfoot on the foam roller, also a great idea. You're going to get your heels on the foam roller to start out, because that is the easiest version. If you're on stools, that might be too pokey and weird on your heels, so don't do that. What you're going to do is you're going to make sure your pelvis is roughly in a neutral position, so not too tucked under, not too like tilted the other direction. You're going to press down through your heels to get your butt barely off the ground. So again, butt's just floating off the ground. Ooh. Yeah, and the reaction should be ooh from most of you. You probably haven't worked your hamstrings quite like this. The goal would be, especially if you have low back pain, to not feel your low back and feel your hamstrings. This is one where the back can try to help. You're going to keep your butt nice and low. Yeah. If this is easy on double leg, you can go to single leg, and it's going to be a lot better. And the goal again, keeping the butt nice and low, making sure the back doesn't arch. Okay. And everybody pause. Put your butt on the ground for a moment. We're going to do one more version of this. Then I'm going to let everybody who doesn't have their feet on a foam roller or something else around right now have a shot. If your feet are on a foam roller or something cylindrical, now put your midfoot, your arch on that foam roller. And before you go anywhere, so before your butt lifts off the ground, do a little heel raise where you try to lift your heels up into the air, just so that you know what that feels like. And try to do the heel raise without doing anything else, just so you've got that motion. Okay, when I say heels up in a moment, that's what I'm talking about. Sometimes if I don't tell people what that is before we do it, the brain gets confused and they don't know what to do. Okay, so you probably see where this is going. Pelvis again, roughly neutral. You're going to press down through that foam roller, get your butt off of the ground. After your butt is off the ground, raise those heels into the air. We're getting calf and hamstring together now. Those heels need to go as high up as you can get them while your butt again stays low. For some of you, you'll really feel your calves. Others of you, getting the calf involved will just intensify the hamstring. Again, if this is easy, you would go to single leg. My goal for a runner or a cyclist would be to do like a 30-second hold, single leg, and then eventually we go into a more dynamic plyo version of this. Okay, if you just had your legs roasted by the foam roller, go ahead and switch and let some other folks go. I obviously don't want people to do this to cramping, but it should be intense. So you can cramp back off.
Are you going to show us that?
Alright, take that heels first.
Yeah, so question, how is this different from a glute bridge? What's the main difference?
The foam rollers.
What was that? The foam rollers one, your butt is also the difference, right? In a glute bridge, your butt's like really off the ground, and this your butt is barely off the ground. A glute bridge biases more glutes because you're getting up higher. The foam roller bridge, by elevating your feet a little bit and by only lifting your butt a little bit, you're really biasing the hamstrings toward. I think the glutes are well worth working. You should do stuff for people's glutes. I just think the hamstrings are kind of like under talked about and underloved, and that a lot of people directly going after the hamstring does make a difference in like their pain, and that like you should be doing some like strengthening for the hamstring, and that this is a good way to like start people out. Okay, everybody else who wasn't on the foam roller already, the heels version first. Has everybody gotten a chance to like get on the ground and try this? Yeah. Okay. Heels version is what you're gonna do first. Did y'all do that already? Heels. Yes. Did you do the midfoot version? Yes. Okay. The dynamic version, if you were to progress past this, so like if you got single leg on the ball of your foot, calf and hamstring together, and that's great. The next thing that you would do is little wiggles. You would eventually make the little wiggles bigger, and now you're teaching the muscles contract, let go, contract, let go, contract, let go. So essentially you're wiggling back and forth, back and forth, back and forth, being a little bit violent about it, and trying to get some things happening as you're keeping your butt still off of the ground. There's also a hamstring slider from this position that I really like, that is kind of a similar concept, but that is what this one is. Any other questions on foam roller bridge?
I played around with this
Yeah, like from this position. The way that I initially did it was an isometric. Was it different from what you were doing?
just higher up.
Just higher up, yeah. Like like a Swiss ball or
Like more of a bridge.
More of a bridge. Yeah. So the higher up you go with your butt, the more that like glute and hamstring are working together. Working on your glutes are a good idea too. Yeah. Again, like if you keep your butt low, it biases mostly hamstring. If you go a little bit more, you're getting now like a little bit more glute with a little bit more hamstring. Both are good areas. Yeah. Absolutely. Okay. Sweet. Let me see. Okay. I have another exercise that I really love. Let's go through that one, and then we're going to take a break, and then we'll use our last little bit of time on some strength training stuff and on bites. Okay. This exercise is a kickstand hinge. A kickstand hinge is essentially this position. So one foot is forward and flat, the other foot is more of the kickstand, it is up. The reason that you're doing this exercise, or what you're going after with this exercise, is the ability to like load the glute under tension, and to like essentially do this like foundational movement that our like pelvis should be able to use. So like if I'm trying to improve movement options around the pelvis for like hip pain, low back pain, knee pain, whatever it is, there's like some different directions I want to get the pelvis moving. One of those is like a vertical up and down, that's a squat. Another one of those is a back and forth, that is a hinge, that is a deadlift. This is a way to essentially like help people who are really good at like clenching their booty and like closing off space at the back of their glute to like open up at the back of the glute. So this is eccentric glute. Eccentric glute is really helpful because eccentric glute is what needs to happen. Essentially, like as we are like landing on our leg, there's a bunch of contraction that has to happen around the glute to help stabilize. A good hip hinge can do a lot to like help people, again, clean up movement patterns, move forward. You can also take this directly into a bunch of different versions of like deadlifts, essentially. The other goal of this exercise, or like an exercise like this, is that like you're helping somebody create tension under their own body. So there's different ways to help people essentially load. One way is like getting people to generate tension under their own body. The like foam roller bridge is like gravity assisted version of that. A split squat is a gravity assisted version of that. Anytime that you like start to load somebody, there's a ton of benefits that come from loading. There's also a ton of benefits of like helping somebody figure out how to get like a really strong contraction under their own body weight, and then bringing some of that same tension into a now externally loaded sort of like situation. Does that make rough sense? Okay, sweet. So to do a kickstand hinge really well, it should look and feel like the butt is like getting bigger, essentially at the bottom of this motion. So I'll talk about that in like just a moment. I'm gonna demo this one in real time and then talk to you guys about it, and then I'll let you guys all practice this too. I'm also gonna have you all like watch each other do this. The best vantage point to see if somebody's doing well with this is actually to stand right behind them and see, like, does it look like their glute is like lengthening and getting bigger, or does it look like they're getting kind of like stuck and their glute are stuck somewhere else and like we're not getting that like, you know, big glute kind of motion happening. Okay, so from this position, we've got 1 foot forward, 1 foot back. You're gonna get heavy through your front foot, so much so that like you can pick up your back foot and not really have to change your position very much. The back foot is literally just a kickstand. There's some different ways to cue where the foot pressure goes on this one. I'm gonna give you the easiest way or the like most straightforward way that I use the most often. For this version, you're gonna imagine that there's an orange underneath the ball of your foot, and you're trying to squish that orange underneath the ball of your foot. As you do that, your heel's gonna come up slightly, only a little bit, maybe enough for like a credit card to sneak underneath your heel. From there, your shin is in a little bit of a forward position, and I usually call out to the person, hey, your shin, if I were to measure the angle between the ground and your shin, it's like 80-ish degrees, and you're gonna imagine there's a little telephone box around your shin. You're not gonna let your shin go out of that telephone box. And the reason why is gonna become apparent in a moment. If it's somebody's first time doing this, I tend to have them put their hands where mine are. The opposite hand goes on the crease of the front of the hip, the other hand goes like big just on the back of your butt. And again, this hand's gonna kind of like push the hip backwards, this other hand's gonna feel the butt expand. So you're gonna push backwards from here, the shin stays where it's at, the butt is trying to go back away from you without the shin going backwards. If the shin goes backwards, instead of now moving through the like hip joint itself, I'm moving mostly through my knee joint, which is not the point of what we're doing. So shin is forward, pressure's through the front of the foot, butt's going back, 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 and I'm trying to get my like sit bone essentially diagonally backwards as far away from me as it can get, and I'm hanging out in this position. Most people, when they do this for the first time, they're gonna wanna roll their hips open away from the lead leg because that essentially like avoids having a ton of eccentric glute. You're gonna make sure that people are either lined up or either been slightly rotated towards that lead leg to get a ton of glute, and we're going as far down as we can get, trying to tension again the butt backwards, backwards, backwards the whole time. The goal of this is to feel a lot of glute and some hamstring. If you feel it somewhere else, we're gonna kind of like change the cues up. The other like good cue on this one is you're trying to keep like a nice tall spine the whole time. So if you're kind of like crumply, it's gonna be hard to get that like good glute versus if we've got some like length through our spine, almost like somebody's picking me up right here the whole way, it goes better. Okay, let's have everybody set this up. I'm gonna walk you through how to set it up again. You've seen it.
All right. Cool.
Okay. This is one where after you've done it a few times, you will get better at reproducing the tension we're trying to get. It is tough at first, or it can be tough at first. Okay, so 1 foot forward, 1 foot goes back. If you want to watch a partner, that would be great. I'll go through this twice. So if you want to stand behind somebody and watch their butt, that would be helpful for them. Okay, so heavy into the front foot, and you're gonna imagine you're squishing an orange underneath the ball of your foot. So really start to press that foot down. Heel's gonna come up as if there's a credit card underneath your heel. You're gonna shift your shin forward in space if it's not already forward, so that your angle dorsiflexion is about at 80 degrees. From there, you're gonna take your opposite hand, you're gonna put it kind of pointy at the front of your hip. You're gonna take your other hand, you're gonna hold your butt, and then you're gonna keep that shin forward. You're gonna start to hinge forward, so torso comes forward, butt goes back and away from you, and you're gonna slowly move down into that. As you do that, when you get to the bottom, you're gonna hold at the bottom. You're gonna reinforce that pressure through your midfoot. And at the bottom, you're gonna try to sneak your sit bone away from your knee. Do not let your knee move backwards, just tension your sit bone backwards. You can also think, one of our PTs says, like you're trying to like turn your butthole like up towards the ceiling, which is kind of a crazy cue, but we want a little bit of an anterior pelvic tilt actually puts more lean pelvic glute and helps us out. So think about turning your tailbone or your butthole up towards the ceiling at the bottom of this. Again, we're looking for glute and hamstring here. This is a nice and slow kind of exercise versus a fast one in this version of it. If you're looking at your partner and it looks like their hips are opening up away from that lead leg, you them to either square up or even turn their hips toward that lead leg a little bit. Again, you want the butt to look nice and full during this, and you want the spine to stay long. So my friend back here, can you feel how you're kind of rounding through your back a little bit? Pause for me. Shin needs to come a little bit more forward. Great. Pause right there. I want you to imagine there's a string at the top of your head. Somebody's pulling you up. I really want you to stay long. Other thing, can you pick your back foot up without changing the position of your front foot? Can you balance on the front leg? Yeah, pick your back foot up.
Oh, wait. Oh, okay.
Your back foot needs to be forward. Just like that means, yeah, there you go. Forward on the front foot. Okay, perfect. Nice. Okay, this hand a little bit lower, more in like the crease, your like inguinal crease area. Yeah. Okay, and then from there, stay nice and tall the whole time. You can even, let's change your hand position. Actually, put your hands on the tops of your hips. I want you to like push down through your hands to get nice and tall, and just keep that kind of pressure of hands down, the rest of the body up the whole time. Position is forward. You're gonna slowly start to come forward again. Front head needs to stay in line with torso. Pause right there. There you go. Yeah, keep that spine pinched a little bit more. Yep, keep thinking about sending your butt back as fast as you can. Pause right there. See how you build your hips up? Yep. Rotate your hips that way just a little bit. Okay, can you feel a little bit of glute? Yeah. Yeah, okay, cool. So, can you see how he's a little bit rounded through there? This isn't a perfectly clean hinge. He's still feeling his glute, so we're still happy about it. He's probably restricted through the back of his hip here. You're probably a little bit restricted back through there, which makes this a little bit hard. I want you to keep thinking about nice long spine as you're doing this. There you go, yep. And I would just breathe through that glute. Keep that chin a little bit more forward. Don't let it creep back. There's a little tug of war happening between your butt and between your knee. Great. Yeah. Slowly come out of that. Nice. That feel okay? Yeah. Good amount of glute for no weight, right? Yeah. Yeah. Cool. Questions? Anybody else?
You seem like you hear me, Justin?
No.
I better see you at front porch.
Yes.
Yeah.
Okay. We're gonna take one last little break. I'm gonna run to the bathroom. Let's make this one a short break if y'all are okay with it, and then I'll let you out a little bit before 5.
I really do. What's up? What do you want? I'm gonna sort of. Oh.
Dispersing my mind.
Honestly, I would keep the shin.
She.
Yeah. And then like, yeah. And then you're just gonna gently shift your weight forward and see if that helps. And do you feel like it heavy like on the front of your foot? Yeah. Yeah. Keep that heaviness as you like spread your cheeks. Yeah. Inhale, inhale, inhale. Keep that knee forward. Yeah. And can you drop that right knee down towards the floor just a little bit? Just a little bit like that. Just like that slide we did earlier. Yeah. And then without moving the knee, can you come up? All hip without.
Oh, so we having a movie night tonight or what?
We can.
What are we gonna watch?
What is there?
I passed my drug test.
I haven't gotten any stuff. You should have gotten an email that's saying something about like a refund process.
What?
I tested negative on my drug test. Did you test negative?
I tested positive for loving Will.
Felony levels, huh?
I'm gonna leave them off. I feel like we're just gonna take them back off.
You and having your dogs out. You're like, I'll leave my shoes off.
Well, my favorite thing is you were texting, you were doing this with your dogs.
When I was what?
You were texting, but like
Like with his toes?
no, like with his hands. But his dogs were just like, you know, just like waiting. No, he had him up. He was sitting. He was like this with the dogs, and the dogs were just
And they were just in your
just like,
iPad,
yeah, do something. I know, come on.
A beautiful woman attracts attention.
The curve in your foot was crazy right there.
I've been working on my toe flexion.
Yeah, me too,
Everybody's
man.
been
Every day I get the reps
hitting her
in.
toe flexion.
It's because ever since I got roasted by Garza in class.
Let me see your extension.
It's too good.
How far can you
Oh,
spread
that
them?
pinky.
That's your extension?
What's this one doing? What the dog doing?
That was Ian.
She has the,
Oh, so
I don't know. I wouldn't touch that. Oh gosh.
Ian said all of that. How confident do you feel? And what clients are going to be? I'm sure him. We'll see.
Did you take a CDM this semester? Because who's going to get 1,000 back? Right.
Yeah.
I got like 1,500 of them.
What if we get together? Wait, did you get there was a grant and it's separate. The grant was for and it was on the
okay.
Did you check?
Yep.
Everyone got
Maybe you just got half of it. Maybe.
Yeah, I got that. And I didn't apply for it.
It's just like separate from that.
Yeah. Because I forgot to email all that.
No. They were gonna send them out.
They're all like, oh, no matter what.
It's like email them if you don't want it.
If you don't want it this way.
Oh.
Oh!
Yeah. She was like, everybody that hasn't reached out about not getting it, she's just going to send it to.
Yeah, save my rep.
You're like, oh yeah.
Well, maybe take it over and rent another stuff.
I'm really excited to pay like probably what, like $8 for rent. Because our lease ends like July 2nd.
And you get all those videos.
I forgot that I used mine like last month, which sucked. I don't know what, cause I didn't know there was you have to use them. You have to have a minimum of 1,000. So you can't spend 5,500, 750. So now the last like 500 points I've got the last couple months are just gonna sit there forever.
What's the name of the
Let's do a
Review
little more.
54.
We're not in the next like 20 to 30 minutes going to like iterate through all of the exercises I have, but I'm gonna pick some that I think are good and talk to you all about why I think they're good. We didn't do the hip block. If you want to go back and do the hip block later, it's a great movement and motion exercise that works around the hip specifically. Okay, let's talk some about strength training as well as like a little bit of philosophy stuff. How many of y'all have like worked in some context as a like personal trainer? A couple people? Okay, cool. I'm going to like, does everybody understands that like strength training is a good thing generally, right? Okay, cool. I'm gonna glaze over why it's a good thing and leave y'all to read some of this other stuff. But we know that strength training improves our economy, which is essentially like being able to do the same power for like less energy. We know that it improves force production, which is especially relevant to like sprinting. We know it helps with fatigue resistance. It helps condition our muscles, our tendons to seek load to be happier, as well as our bones. It also decreases injury risk if done appropriately, so it's a good thing. Here are examples of what somebody's week might look like if they are an in-season, very active endurance athlete. Versus what I would recommend for somebody if they are off season. Not everybody in our clinic works out like 6 days per week, but if someone's like, I really want to improve my fitness, I want to lift, I want to run, or like, I want to run and I want to get faster at running, then I'm like, you gotta lift some. Here's an example of what that could look like for somebody. Typically, I really recommend that people do things in seasons. So like, you're gonna have a time, whether that's like 3 months, 6 months, whatever it is, where like you're working on bike fitness and then or run fitness or whatever it is, and after that you're gonna take a break and you're gonna be in off season. I would love for your off season to be at least 3 months long, because getting actual adaptations from strength training does take around 3 months. Sometimes people cut that short, especially if they like race bikes here in Texas. But my typical thing is like, when you are in off season, you are not just sitting around. If like we've had problems with injuries before and we need some more strength training, or we're trying to just get like stronger and faster off of the bike, we're gonna shift into more lifting mode, where we're doing like lifting, ideally 3 times a week, and some aerobic exercise around that. I also break out for people low conditioning days and high conditioning days. So some like novice like runners and cyclists make the mistake of making all runs and rides hard. Not everything needs to be hard. We also need base miles that are like a more chill pace. Zone 2 cardio's gotten like a big name. It takes a long time to be a true like zone 2 runner because of just like the aerobic adaptations that have to happen. What needs to be true is that like you should feel like there are easy days and you should feel like there are hard days. We want to minimize the amount of like medium days that you have. Easy days essentially like keep things rolling and keep you moving along without taxing your body so much that like you're really tired. Hard days like push your capacity and like, you know, actually challenge you and also improve your aerobic and anaerobic capacities. So we need a mix of both. We don't need a mix of like half-cooked middle ground days where like the workout is hard enough to like make you tired and like kick your butt, but not hard enough to like really push you. So high conditioning is like long rides, fast rides, interval training, that kind of thing. Low conditioning is like your base miles. It's kind of what we're going for. Okay, so that's an example. When you're designing a strength training program, it's tough. There's a lot of things to like keep in mind. You don't get a lot of this in school. Did y'all get some on strength training in school and like program design? Maybe a little bit, maybe not very much. I didn't get any. This was like all continuing education, learning from other people for me. I wish that we did a little bit more of this, but when you're trying to decide like which exercises you're gonna do as well as like how to emphasize those exercises. So like there's a difference between doing split squats like nice and slow for 8 reps versus doing split squats in a more like dynamic, like fast on the way up way that like biases different things. There's also a difference in doing like a weight that is like you're starting to fail out around rep 8 versus a weight where you're starting to fail out around like rep 20, for example. So you kind of gotta pick like what you're trying to do the most of. Are you trying to improve power? Are you trying to reduce injury? Are you trying to like work on pain? Do you want more muscular endurance? Are you trying to like pay your bike taxes or your run taxes, which is something I talk to with people about. The other thing is like somebody's experience level with lifting also indicates or like limits or like changes what you're gonna do, as well as my overall thing is that like specificity matters. So like I'm happy that more people know in general, like more of just like lay people, not like physical therapists, know that like strength training is a healthy thing to do for your body. I'm less happy that like in a lot of people's minds the way to do that is like I'm gonna do like the big 3, like bench press, deadlift, and like back squat, because like are those movements that like get people stronger? Yes. Is it absolutely better than doing nothing? Yes. Is it the best way in my mind to train for like running and cycling? No. Is it the best way to train for like general athleticism and like a body that moves well overall? Also no. Like those exercises kind of overemphasize the back extensors. There's much better ways to build a more balanced program that like helps balance like somebody's movement capabilities and getting strong without kind of like overemphasizing back extensors. And like you've seen the like people who kind of look like fridges and walk around like a fridge, the very like strong powerlifting people or bodybuilding people. They move like that because like they practice like creating a ton of stability through their spine all the time. There's a price to pay for that, and that price is like not rotating super duper well. A runner and a cyclist need to be able to like move a little bit better than that, so I don't tend to recommend like powerlifting or bodybuilding type movements for those people because that's not what their goal is. If I were designing a program for a bodybuilder, it would look different, but that's not my bag, so I do not do that. Okay. Basic components when you are designing a program. There are people who've got all types of opinions on this. I've done a lot of programs myself, have read a lot of people's other programs, and like here's when I'm designing a program, I want a squat motion, which is vertical pelvis. I want a hinge motion, horizontal pelvis. I want an upper body push. I want an upper body pull, and I want ab. The other variants on things is that like I typically want a double arm and leg version of something. I also want a single arm and leg version of something. So like almost everybody out of runners and cyclists gets a double leg squat and double leg hinge, and a single leg squat and a single leg hinge. My single leg version of things for a squat and hinge a lot of time is a split squat and a kickstand hinge. create it easy. It could be a bunch of other things. You could do a single leg RDL, which should keep more of a stiff knee versus like, you know, having that shin forward and moving a little bit differently like I showed you. An RDL is a little bit more balancy. If I want to work on balance, maybe I will. If I'm more concerned with how your glute absorbs force, I'm going to put that back leg down in a kickstand and move that way. So there's a lot of little decisions that go into this. The other thing that I'm balancing in a program is output exercises versus sensory exercises. This blurs the line between the previous category and strength, where like some exercises I'm like, turn your brain off and just move. That's the goal of this once we're comfortable with the movement and once we've kind of got you started. There's other exercises where I'm like, I do want you to feel your hamstring a little bit more, and I am having you pay attention to where your pelvis is a little bit, because if your pelvis is a little bit in a funky position, you'll feel your back a little bit more. So there's a difference between like balancing, giving somebody a program that like has a little bit of some brainy stuff and like some exercises that's like turn your brain off and just go, essentially. And there's a balance to strike between those. I'm also of the mind that like a lot of conventional strength training stuff that's like pretty popular doesn't really involve any rotation, and I think that like rotation is a basic inherent human movement that happens like as we walk and as we run and as we move our body. So like as we're walking and running, our rib cage should go one way, our pelvis should go the opposite way, kind of like we're wringing ourselves out like a towel. So I purposely will include exercises that like emphasize that rib cage and pelvis counter rotation, because it helps with people's movement efficiency, but also because it's a great way to help like decrease back pain and to help the spine remember the way that it's like supposed to move, essentially. So I do think there's a place for like anti-rotation exercise. I just think again it gets like overemphasized, where like I've seen a million different versions of like doing a like essentially like set your core and do like a pull-up press, set your core and do like a dead bug, set your core and do whatever else. Cores are not meant to just be set. There is some time where your core needs to stay stiff while your arms and your legs move around it. There's other times where like you need to rotate through your core and like produce power, right? So like if you only ever train people on anti-rotation, you're like potentially creating some like fear avoidance, and you're also like not being realistic to like how bodies actually need to move. So you need to train rotation. Okay, how do you actually introduce somebody to strength training? First you gotta acknowledge that strength training, just like any other sport or skill, takes time to learn and time to become competent at and time to become comfortable with. Honestly, I think of it like any other sport. Like if you got into volleyball like this year and you've never played volleyball before, it's gonna take you like several months of playing volleyball before you feel like anywhere comfortable with like, you know, putting the ball where you want it to go and like getting your serve and doing all of those other skills. Strength training, honestly, like if you've done strength training for less than a year, in my mind, you're probably still a relatively beginner lifter who's got some more things to learn. If you do it every day for a shorter period of time, maybe you get there faster, but again, it takes a while. At first, the best way to introduce somebody to these movements is under body weight or relatively low weight for like the arms, and to make sure that like the movement looks good, make sure that they feel comfortable, especially if you're working with somebody who's been in pain before. If you're working with somebody who hasn't been in pain before, maybe outside of a PT context, you don't need to go quite as gradual, but you know, pain makes us want to be a little bit more gradual. From there, you tend to transition into more of like strength for endurance, and what that means is lower load and higher reps. So we're not trying to create the strongest muscle contraction that we can create. We're creating like a low to medium muscle contraction for a lot of reps and getting the body comfortable with that. From there, we can ramp it up to strength for power, which is really where we get like a lot of those benefits of the like injury, like reducing injury, and essentially being a movement that is like different enough from cycling and running to make a difference, right? So that's higher load and like lower reps is what we're looking at for there. Time under tension is also king for helping it dictate like what kind of adaptations that you're going to get. It's not like something magic happens at like the 30-second mark where you like switch from like absolute strength to hypertrophy. It's that like this little bit of a blend, but like if during a set you're having somebody stay under tension for like a minute or more, you are going more for like endurance, versus if you're having them stay under tension for a short amount of time, you are working a little bit more on strength. So like that isometric that I had you do that was like just body weight, if you held it for like less than 30 seconds, you're working on strength. Are you working on strength in an incredibly profound way? No, but like you're doing something, and you're kind of like getting things working. So deciding what you're trying to target, again, for like people starting out, you're starting more here, where you're doing like lower load for a longer amount of time, and as you're kind of working on things, you're moving up towards like higher force over like a smaller amount of time. Does that make sense? Yeah.
The bottom note was this lower for more highly trained
muscle recruitment and like kind of motor control happens more easily for somebody who's practiced whatever movement that it is, kind of like over and over again. So somebody who's an experienced lifter can get a like stronger contraction faster than what a like more novice lifter can, essentially. So it's like if you're trying to do something that's more on the motor control, kind of like coordination side of things and like do a different motion, if you're already an experienced lifter or you've done a motion like that before, the kickstand hinge is a really great example of that. For somebody who's practiced that kickstand hinge like a lot of times, they can get like a good glute burn going on like the second like rep of that, maybe after like a 5-second hold. For somebody who's newer to that movement, because you're still trying to figure out exactly how that is, your brain's like, what's happening? You might have to stay there for like 15 seconds or more before you feel the same level of glute burn as somebody who's like, I've done this movement, I know how to like get this to like ramp up faster. Does that make sense? Cool. The other thing that is true for folks is that when you first start like strength training them, the first thing that happens in the short term of like why you can lift more weight faster is just that like your brain gets better at like contracting that muscle, right? What happens over more time, more in the like 2-3 month mark, is that we actually get changes to like the muscle fibers themselves, and we get more of that like deeper physiologic sort of change that sticks around for longer versus just the like motor control version of that. Okay. I did a program with this group called Rebel Performance for a while, and they kind of laid out some options for how they structure their strength training sessions. I thought this was a really good way to like understand like how you can do a program, and I generally like their format, where they tend to like warm people up with like power at the beginning. You might have a reason for putting power like further down into the workout. For these people specifically, they did train a bunch of like primarily strength training, bodybuilding, powerlifting type of people, and they used like plyos as a warm-up or power as a warm-up, and then they got into their like main lift, and then they did a secondary main lift, and then they did sensory upper and sensory lower, which typically is like a brainier exercise that involves like one side moving at a time. And so I thought that it was helpful to think about organizing somebody's weeks that way. This is another example of like how they might organize something for like general population who's going to work out twice a week, where it's like we've got main output exercises, again, that's like more brain off, just move, and then we've got some like movement improvement, a little bit brainier exercises. They were really big on side abs. I'm also big on side abs. I'm also big on like regular abs as well, but I think that like it's easy to overlook the obliques. You do train obliques if you do rotation, so do some rotation. Here's an example of a general exercise program that like we as a clinic wrote together for like a general cyclist. So it follows a little bit of a similar format to the thing that I just showed you, where we're warming up with some plyos. We've got some hops to kick things off. We've got a main lift next. We chose not to put a conventional deadlift, a double leg deadlift into this program, just because double leg deadlifts are a move that like some people are totally fine with. A lot of people struggle with them. And this particular template was meant to be a like easy intro. Most every cyclist could do it. Obviously, like you know, essentially like when we're trying to grade somebody into strength training, a lot of the time like we'll work off of a template like this and maybe modify like a couple of like exercises on here. But it's essentially like before I make something hyper specific, I need you to do just like certain basic movements and kind of like gain some competency with that. And this program is meant to be like a chunk of that, where like I might give it to somebody as is for a cyclist, I might modify it slightly. But we've got like a main lift, and then we've got some abs here. We've got like a dumbbell floor press here. It was also meant for somebody who like maybe doesn't have access to a gym. We've got like a row that you can do with a cable that focuses on side ab, and some other fun variations of things that kind of hit like both upper and lower body core. Yeah.
I see RAR, and like in my understanding is that like to do reps in reserve, you have to know what failure actually is. Do you take your clients like to failure when they're with you, or is it just like kind of by feel?
That's a really good question. So what I tell people is like, I'm looking for, especially for like more novice lifter, I'm looking for when form starts to break. So it's like RIR means reps in reserve. So it's essentially like how many more when it's a novice lifter, it is how many more reps could you do with good form before form starts to break down. So if we know, I will typically push somebody until form starts to break, point out to them what that feels like, make sure that they can understand that. For a more experienced lifter, I would actually want to like push to failure, but that would be like somebody's doing pretty well, you know, we've got a good handle on. But yeah, reps in reserve lead to form break. The other numbers that are on there, like the 3-0, 2-0, is an indication of like what the tempo of that exercise should be. So for a heels elevated goblet squat, we're holding the like kettlebell or the dumbbell right here. The 3 means how much time you spend on the way down. The 0 means how much time you spend at the bottom. The 2 means how much time you spend on the way up. And the 0 means how much time you spend at the top. So this is 3 seconds down, no pause, 2 seconds up, no pause, keeping it going. Does that make sense? Let's see if there's anything else confusing on this. Cool. Okay, most endurance athletes struggle to get strength training done. I made that clear already. I said make it suck. Yep, some is always better than none. Basic is always, is sometimes better. Runners do need to hit calves. That's a non-negotiable for me. That's like more negotiable for a cyclist, but like it's hard to get around working on that for a runner. I'm a big fan of Toe Pro. It's a really smart piece of foam that actually Pyro designed. It's got some little divots on the back. If we had a ton of time, I was gonna let people try this. If you wanna stay afterward and try this, it's a crazy way of like strengthening efficiently both the bottom of the foot and the calf at the same time. I'm not a big like fancy equipment girly unless I think it's actually worth it. So like I really do think the Toe Pro is actually awesome, particularly for like folks who are trying to get stronger on calves. There was like a small sample size study that they did around this that showed that it's around like 3 times faster at like helping somebody strengthen their calves over just like basic heel raises. And that's enough of a difference for me to be like, cool, for some clients, I will recommend the Toe Pro specifically. I've got 2 of them, so if you want to stick around afterward, I would be more than happy to show some folks how to use a Toe Pro. I love the hamstrings. I think people don't talk about them enough. I also love the glutes and the quads and you know, all of the other guys, but I just really love the hamstrings. Okay, we're going to do a little bit to practice. We're gonna pick maybe one more exercise. We're unfortunately gonna run out of time for me to hit the plyos. If you want to hit the plyos, I've got a lot of good like hopping practice for you to like do, as well as like cues that I like on plyos. Plyos are super duper important. Yeah, is there anything on this list that anybody is particularly excited about seeing as I try to pick what we're gonna do here? Adductor side plank. Okay, yeah, I really like that one. This is a little bit different from a Copenhagen plank. The floor would be kind of hard for this, so I'm gonna show y'all on a table. But for the adductor side plank, you're gonna essentially get set up with like your elbow right below your shoulder. Your foot is going to be on the ground. You're gonna kind of rotate your foot a little bit so you can be on like the side edge of your foot, so you've got something to press against. Before you go anywhere, you're essentially gonna create tension down through your foot and down through this elbow to kind of pre-tension things. You're also gonna try to like pull into your side out to kind of pull those 2 places together. From there, level 1 of this is the hip comes off of the ground. I'm using my side abs. I'm also using my adductor of the top leg. Level 2 of this, we've got a tiny bit in the leg going, would be to lift this leg up. Level 3 of this would be arm goes up and you get nice and tall. It's really easy to get kind of punchy on this one, but we're hitting side ab and adductor together. Let's let y'all try that one. It's a variation. It also like because of the like setup of like being down and one leg being up, it does imitate your being.
Oh, sorry.
Especially on the last one, where you're getting nice and tall, lets you kind of focus on the advice on cooking. Top leg is long, bottom leg is thin. Yep. If you've got it all set up, I would add a little bitty chest bump on at the end, just so that you're staying nice and tall. You're trying to find a balance of like your abs on the front side of your body and your mid back on the back side of your body to hold you up. I got a good question on like difference between this and Copenhagen plank. Why would you choose one versus the other? One leg being down and one leg being up replicates like what the body does when it's sweating. So like I like this variation just because we're practicing like that same kind of pattern. Nice. Yes. This one's also fun to look at. A lot of times you get some fun side-to-side differences where on one side it's like not that hard, on the other side it's like crazy. So I would try both. You want it to kind of be in that top leg. You don't want your knee like it's like all the way locked out.
That one's just, I kind of like it.
I mean, better than two.
Okay, let me kind of wrap up here. I'm gonna pull up the video and the picture of this bird dog with rotation, because that is also one that I like and would recommend you trying. I'm sure everybody's at least seen and has probably done a regular bird dog. Difference between a regular bird dog and this one is that I am going to actually rotate. So I'm trying to keep my hips level while my ribcage counter rotates backwards. Again, like a really good way to prep for running, because I'm essentially working on the sling of muscles that goes from like this shoulder that's running back to this knee kind of all together. And a good way to, again, judge up something that you already know, add a little bit of rotation to it, and make it just a little bit more relevant to somebody who needs to rotate. Okay, all these other ones you can totally look at home and they will also be good. And then I'm gonna give you, there's other plyo stuff to try. Yep, I even gave you some extra bonuses because I didn't know how much we'd get through. Okay, my favorite recs for you as an SPT if you're interested in learning more about this stuff. Number one, working out regularly and pushing yourself. You might be too busy in school to do that regularly right now. In clinicals, it's going to be more like you've got just like a normal job. If you're interested in all this, you want to improve your craft, get back into exercise or get back into working out at whatever level, pick something to train for, start to learn something new. Beyond that, if you want to learn more about some of this combination of all these things together, David Gray Rehab is my favorite person for this. I would start with his program Lower Body Basics, which is a self-paced working through an exercise program that's awesome for the lower body. I also we have all of his programs at Eastside. We use a lot of his exercises. I really like them. He's very smart about combining the movement improvement stuff with the strength training in a way that is awesome. I also really like Gait Happens, especially for education around the foot. The foot is really important to be good at if you're working with runners because foot pain is super common. I really like the Gait Guru course and have everybody decide do that at some point after they start. I didn't really talk about it a ton, but I've been really influenced by Functional Patterns as well. They've got a 10-week online program that combines self-soft tissue work with posture-based kind of exercises. I train at their gym in Terrytown in West Austin. I really like it. And that's been awesome. If you look them up on Instagram, they post a bunch of inflammatory attacky shit on Instagram, but their actual exercises I do like. And the people here are cool. I didn't make up any of the stuff that I showed you. I'm a really good curator and a problem solver, but I learned from a lot from the people listed here. I learned a lot more from other people that I've chatted in person or talked to in person or been online with, but those are other names of people and things that I like and appreciate. Any questions? Yeah.
When an endurance athlete is in their off season and they're trying to just maintain their fitness or not lose a bunch so they're not having to restart, how do you decide the dosing of what they're gonna keep in their programming? How do you adjust their mileage, I guess, for that off season?
For sure. A lot of the time I'm talking to people about what their specific goals are. I'm also acknowledging to people in your off season you are gonna lose some fitness, but if I had my way during your off season, you're using that time and energy to get into the gym and do strength training. So it's you can only make so much progress on somebody's body in so many different ways. And if we put all of our coins that we have to use in the aerobic bucket, then we don't have any for the strength bucket. So it's an adjustment of okay, hey, you went from riding 10 hours a week to now, I just want you to enjoy it and go on a ride with your friends over the weekend. If it's a 2-hour ride with your friends, that's awesome. And maybe you go on one more spin during the week that's an hour long, but it might be an hour based, I'm bringing you from 10 hours a week to around 3 hours a week is a good adjustment to make. And telling people take a mental break. Don't leave stuff with your bike. Go lift. That's kind of how it goes. Any other questions? No. We're always looking to get to know great future PTs. There's a couple of people in your class who either have shadowed or have reached out about shadowing. If you want to come shadow, we would love to have you. If you want to see how all of this, like how the rubber meets the road, because it's one thing to like talk about, it's another thing to see how it plays out with clients. So if you're interested in that, give us a holler and let us know. All right, cool. You're welcome. Yeah. If anybody wants to see the GoPro, socks are fine. If you actually want to experience this, you will need to take your shoes off. Socks are for this. Okay, I usually have my use in front of the wall, but there's people I can do that way. Okay, so okay, cool. I'm gonna run hands through this at this entry table. So kind of the warm-up exercise for the toe pro is that you're gonna put your toes at the like very beginning of it. The base of your toes or metatarsals is still gonna be right on the ground, and you're gonna do both feet at the same time on the two knees, like so for your warm-up exercise, and hands can go here for balance if you need it. Hands up just a little bit more. Okay, you're going to press your toes into that piece of foam. You're going to do your best to just do a press and try not to like claw into the foam. If we're getting a little bit of clawing, it's okay, but you don't want to like super duper claw. What you're going to do from there is you're going to lean from your ankles into that. So you're going to essentially come to some dorsal flexion, then you're going to slowly come out of that, again, keeping your toes pressed down the whole time. If anybody else wants to do this at the same time, you're welcome to grab that guy. And let's have you do that just a few more times, keeping that toe pressed down, leaning all the way in. Coming all the way out. Good toe pressing. Okay. Exercise 2, the meat of what we're going to do, you're going to put your toes up into this big like crescent in both feet. Yep. About like that. Okay. And kind of as you're standing on that, can you feel how it's slanted downhill like that towards your heels, but it's also slanted like this, kind of like the top of a little mountain. Okay, so what you're going to do to start is you're going to let your weight be heavy on the outsides of your feet, kind of where it wants to kind of take you, right? We're going to do a heel raise. As you're on your way up, you're going to move your weight from being on the outside of your heels to being at the base of your big toe as you're on your way up, so that by the time you're at the very top, you're heavy at the base of your big toe. Go ahead and try that. Hands, you can use them as much as you need. My goal would be to not use your hands a ton. You can move backwards if I can. A little bit. Okay, can you feel kind of that roll from outside of foot with you happening? Okay, great. Now, we're going to add in the toe press down that we did. So you're going to make sure that your toes are still in that crescent. You're going to press down through your toes. You're going to keep that press down as best you can. Get that big toe down a little bit more. Keep down that side. And then you're going to, again, roll weight from outside of foot to inside of foot. Slow, 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 slow. And then on the way back, same thing. Rolling from base of big toe to the outside of the foot again. Keep that big toe down. That's hard, huh? That big toe wants to be up. Cool. What's that feel like so that other people know kind of what's going on? Because not everybody will put their feet on this.
I feel like it's just like more challenging with controlling and for that because some of those like actions really like calves and like traps.
Yeah.
It's just more important to feel more like trying inner toes than calves.
Yeah, yeah. And like if somebody's calves are already a little bit strong, then like this might challenge their like foot and their arch control a little bit more. What did it feel like to you? Your toes want to claw. Yeah, a lot of people's toes want to claw. And again, we'll look at that is okay. The second exercise, the main one that I'm going to have you do is you're going to put your toes back in that crescent. And now instead of doing like a straight knee heel raise, we're going to do a little bit of a crouched or a bent knee heel raise. So you're going to crouch your knees forward. That same toe press down is going to happen. That same roll from outside to inside is going to happen. But now instead of your head going up and everything going up, you're going to do kind of like Michael Jackson knees forward. Really silly. You can give my kiki if you want to. You don't have to. And you're really trying to get those shins forward as far as you can. So like go, 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 go. Yeah, there you go. So this is more of a bent knee heel raise that works a little bit. It involves soleus a little bit more, right? It's also a little bit more relevant to like how somebody's actually going to hit the ground since we're not hitting on a straight leg. Obviously with the straight leg we bias a little bit more gastroc. Gastroc and soleus are both good. The last exercise for dosing on this, the warm-up exercise is like 30 seconds. The meat of this is you want people to build up to 4 rounds, so 2 of each, 2 straight knee, 2 bent knee, of 25 reps. So you want 100 heel raises total. That would be for somebody who's like pretty sporty and wants to like actually run. If their toast and form starts to break before the 25 reps, which is what I would expect, 8 reps, 10 reps might be a good place to start, but like telling somebody like we're building up to 4 rounds of 10, 4 rounds of 25. The last exercise on this is a like kind of tendon conditioning burnout exercise. You're gonna put your feet back or your toes back in the crescent. You're gonna again press down through your toes. You're gonna lift your heels up just to where the bottom of your heel is like flat with the ground. You do your best to keep your own balance and not let the table help you. And you're holding to fatigue, essentially on this one. This is the like set of 4 exercises that if you buy the Toe Pro or that are on like the Toe Pro website that I tend to run through people with first. There's like a tib post and a peroneal, 2 specific like tib post and peroneal exercises where essentially instead of standing straight on the Toe Pro, you put your foot like this and one at a time. So that slant essentially asks the like muscles on the sides of your legs. It's different if you do it like big toe downhill versus peroneals work a little bit more, and if you want to try that one, I want you to try that one as well. You can tell us which side you feel the tib post more on, and which side you feel the peroneals more on. So again, yep, toes are just on the other side of that little mountain ridge. It is hard to do this one. It is very balanced. The heel as high up as you can get it. Go, 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 go. Ooh, yeah, put your hand out to get the balance. Hard, right? What do you feel more tib post or more peroneal? Yeah. Typically people feel, sometimes it's flipped in terms of what people feel, which is a little bit goofy to me, but typically people feel more tib post if like the big toe is at the bottom of the hill, because tib post is then more on length, versus post will feel more peroneal typically on this side. I usually have people work on both of these. There was another cool study cited by the like guy who came up with this that said that like one of the differences between like mid-level sprinters and like elite sprinters is actually the like strength of their peroneal muscles, and that like elite sprinters like do use their peroneals a lot to like help them move, which would make an argument for like training somebody's peroneals up, especially if you care about going fast. Something like this, tib post like shin splints relevant, tib post like to not be really relevant. But I would do the regular set of exercises first for a while before adding in the fancy version if you are gonna progress this to that. Yeah. Cool. That's the toe pro. Yeah. You're welcome.
But I feel that
10 out of 10.
hey, that's not bad. That's not group discount.
A group discount.
I'm not even thinking that you come back.
I like podcasts. I've listened to a few episodes of it. It's been good. Which one are you really
20 people right now. Swear to God. 20 people want to get one.
Yeah. David Gray's got a good one too. You're thinking, yeah.
Yeah.
I don't know why you don't want to set food here. My fiance was watching it with me. I thought it was so funny. You know, no, they don't. Yeah, I saw the trailer.
Yep. Yeah, send me an email to that one. What's the name again? Yeah, send me an email. If you like to shout out for you.
Yeah. Okay.
Sweet.
Yeah, I gotta do that. Is there one more vision also? Is it? Mine's maybe. No, mine's zero. Got 20 steel.
like that regular vegetables. Damn, I need like several.
Looking like a classic hospital worker, you know.
I like the show Scrubs.
Like, yeah. Grey's Anatomy.
If you walked into my PT clinic looking like that, I'd be like, yeah, you've been crazy. I trust you.
I noticed it after posting a lot of like lunges and weird like.
No, I just.
You think you're bad?
I've been coughing a lot. No, I just did. I have this thing right now. No, I haven't. We're gonna go.
Like a little on the medial side, yeah.
Because I was gonna say
Besides,
if we finish early, like Tom is the appointment at 2, if anyone wants to go home with me.
I did.
Okay. Yeah, I was.
Yeah, I love it.
Well, they do. Okay.
I feel like that's a pretty basic. Those are even look really like. You might just do that and like. Yeah. Oh, have fun. Is it the girlfriend list? Yeah. Arlie said it was so good. See, everyone's been saying that. No, she said it was so good. I'm so excited. Okay, we'll see. We'll see how it goes.
I can't wait for the photo.
Yes. Are you gonna watch it? No, well, she already told me everything that. Oh, okay.
But I haven't been able to do park rec.
Well, we'll tell you.
If you notice it with cycling, I have exercise.
I'll wait with you.
So I've been trying to just work on conquering that. And I do notice that if I like swing for wrong here time or that one of days where I'm doing it, it'll act up.
What are we even push for these days?
But it does like to show with stuff.
Yeah, right. And aside, with the exercise and assessment, have you heard of or done any like you take breathing for like
Tired. I have not heard one of terrible shows. So it's possible that I've heard of like concepts that are similar, but not that specific.
It's not like a, I mean, it's interval, it's very kind of like the body.
Yeah, but I just don't like
It's like breathing training and my track assessment.
I love that.
But you want to be there, that's more than your last week. And the thing is, I go Sunday to Thursday. Friday is that. I kind of like my Sundays. I like my Sundays, but Friday's not my
That is really solid stuff that I wish we could talk
So you also started using.
I told you.
I know it's happened like overcome. You're gonna talk about with other people. Like it was. I went undiagnosed. It wasn't until I've been doing front like together and somebody else like wasn't like we get a lot of like show up and but it's like I just like yeah right I'm not worried about it. We're obviously getting
That's what it sounds like. Yeah.
But we were doing like this continuous line, and I had to stop before a new guy with like super intense form had to stop. Something's not right. What the heck is going on? I finally figured out. I have done VO2 max testing.
Send me 2 PowerPoints. I have to learn new lab values. So I just give you that, and then I still gotta go over
Yeah,
the
yeah, no.
PowerPoints that
Apparently it's like a 1.2 system.
versus the normal value.
Yeah, so that was. I'll definitely look into that. 'Cause if anything that can accelerate it, like.
The premise of Oxygen Advantage is helping recondition your body to tolerate more carbon dioxide
Applesauce?
as a natural occurrence of like having asthma. Your body loses, or symptom feels that way, but your body loses its like tolerance to carbon dioxide building up, which makes it easier to like, increase respiratory rate, easier for that like air hunger feeling.
What are the new oncology?
Essentially.
Oh, that's-
So like, it doesn't work on all the mechanisms of what causes asthma, but
So-
it is a like helpful.
Again,
It's
oncology
physical
dogs are
therapy
very,
version of
like,
like
basic
how to
biology.
improve that.
Yeah, no, that
Oncology
sounds
values.
awesome.
Yeah.
Yeah, so
The advice you've gotten on it.
let's see. For example, white blood cells are normal is for 5,000 to 10,000.
Like
There.
it's like yeah, I got both of those. They
Just a little bit. I think the normal was I saw 4 to 11,000.
Okay,
For what?
Oncology lab values.
so
For your knee, are there any exercises that you said that
Yeah,
you
I didn't know it was gonna be in oncology, but I have an interest, so I guess it worked out.
hasn't been acting up as badly.
I find it
One
interesting.
thing. I did do a
And
lot of
then
work for
hematocrit,
PDM because it
there's
wasn't on
normal
that
value
side
for
but I do think I overcompensated where I was starting to
yeah, he sent me a PowerPoint.
do too much. I also
So I
noticed
just
that
skimmed it. I didn't even sit down to look at it. I just opened the
tibia
email
and
and
femur
skimmed
got
it.
where they weren't lining up 100% on that. So I had to like work on my activation of like, hey, let's not just do this thing.
Are you doing outpatient first?
I got that.
I'm gonna go over all of ortho while I'm in my acute care.
And just like working on like the activation, making sure I'm keeping.
And then that we have like a break, try to go over cardio form for my acute care again.
So it hasn't been like super bad, but it's like it's definitely still like I
No, it's
again,
just
if
the
I
first
cross
one,
my
but the
legs,
second one is just a couple minutes. Yeah, the
it was
first
like
one
it's
we
I got
figured
it
out,
out.
it's
It's
just
just
like,
like
yeah,
I'm just like
so I'm gonna
I don't like
just look over some cardio, so a little bit of maybe afterwards that after stuff. And then during my acute care, if I'm still having trouble, just skip it again. But if I feel good, then just start looking at some more. But the second one is ortho, I'll change it.
Yeah.
Results physiotherapy.
Really looking back.
yeah. It is my left quad is tighter than the right.
Embryology related stuff?
I think like now that everything is just way less crazy, I probably need to do some more soft tissue work rolling on it. I have some like just a low work that I'm sitting.
And then-
Yeah, the big
There's one of them we don't even know yet.
But that's stretching is a great option. I'm sorry, good to bring that up there.
Yes.
So it's like it really has to be some sort of
3 and 4. We have
and we have that one, so I think we're probably going down that a little bit. I have been working on
I mean, it's not the same guys anymore.
I know. I was about just when, like, even if we like go over all this stuff.
You know,
Not
doing that well.
I would also be targeting, so like the version of
less than I have. And I had to do that, you know, and then like, it's just not
version of
I was
like,
stretching,
when like
yeah.
did you feel like the dog seriously feels so much?
I know.
What I would do specifically for like this one side, like in front of the knee, would be I would move that. So we did the middle ground version of like hamstring, like 99
You know?
and like knee rolls is like for you to shift your left knee down and your right knee up, and then for you to like get really strong and like, contraction on that left hamstring. I mean, where you like do a little bit of like a march where you like lift your right foot off.
They know, they say like,
Wall a little bit, essentially like reinforcing your strong like back of leg contraction. That would be one of my, you know, one of my lower level exercises that I would try. I would also want to
me, but like there's some part of my brain that doesn't want it. So I assume it's doing something wrong here. That I just don't like consciously recognize in the same way as to why. Like I'll find myself working on this side, and on the other side, I will do like a backwards knee type thing, and I'm just like, I don't like that, and I force myself to fix it. So it's like it really doesn't.
If you do call it a ball sit, with the same kind of like
One thing to know about me, my muscles shake. They always shake. Even when I'm not struggling, they just do that. I talked to Dr. Rick about it, and she's like, that's just how your muscular stuff is. So I always look like I'm struggling when I'm not. And it like borderline looks like slowness. Yeah, no, when we were doing the wall ones, the 1990s, it like my hamstrings were borderline going to like actual
How was it?
and I was like, I've never
Good.
had that
My
before.
boyfriend got a party card.
But
Yeah,
I,
shot it, so.
again,
I
it does
heard.
track
What?
related birthday stuff like that. So starting to.
Yeah. Your parties?
will it come up right away?
Did you call your brother?
I think it's delayed. I think it's delayed where like it gets activated and then
Well,
like starts showing up for a while.
I'll call him. He texted me first. I was surprised.
Again, it's just goes back up to mine. It's been pretty decent for this week again because I got a little bit more downtime.
Yeah.
But that led to more downtime, so it was pretty happy with that. But coming back, I'm like burning feeling again. I had to when they leave since coming back, but again, it's just like. And I'm just like, I want to get rid of you. I'm very much that bodybuilder living type of thing, right? Like my goal for my body is to just do what you have to think, can I do that?
Yeah.
So,
If you're in a place where like things are a little bit more calmed down and like the window is open and some change happening, your task is going to be like, how do I like load in front of my knee appropriately? It's like Goldilocks right amount of loading. Little it, even if it depends if too much, it'll bring it
I
down.
was thinking those like elevators, like just from my inclination, that those might be a really good.
If this one elevators are too much, my regression is like a wall. Just because the shin doesn't go forward, it's not the leg, you can have a wide side onwards. One side versus the other. Yeah, split spot elevators might also be a good place for you to start out. And again, like a lot of times like bodies that are a little bit removable also have a pattern of like delayed.
Yeah.
They're just being like, okay, that's just how it goes. So I'm gonna collect my information and try to slowly increase the amount of that.
I was gonna ask.
Hopefully that gives you a little bit to work off of. I really do like the foam roller bridge though. I know I've said that already. I think twice, but like it is money when it comes to like front of you.
Okay.
And like putting that part of your program and like it's also nice to get really strong contraction without it. Like it is rare for that to like diss off the front of the knee.
I get you.
Like
It's
what happens.
like a
Yeah,
way
it's
of-
really safe.
Yeah, it's like increase the amount of contraction by increasing the stability rather than additional load.
Yeah. Here's working on the other side. Yeah. And telling those muscles, hey, you also gotta do something inhibiting in front of the quad with that as well, which is nice.
I think I got some other people who want to
Yeah.
take your brain.
What do y'all got? You gotta go first?
I guess just real quick, it doesn't have to be like a full detailed explanation, but so when it comes to CSCS and you want to work with endurance athletes, do you recommend getting that?
Do you have previous experience with strength training already?
No.
No. Do you lift a little bit yourself?
Yes.
Yeah. Okay.
I
Cool.
just haven't been doing a lot of lifting because of school and
For
busy,
sure.
but before
Yeah.
school I'm very consistent and everything, and I plan to after
Nice.
school as well.
Yeah. Like at this point in your career, if you have time to like study up for the exam and just like learn all that extra stuff and like get it under your belt, like absolutely that would be a good idea. The other thing that I would recommend is like if you haven't like bought a program from somebody else who's like stuff you like from what you can tell online, I would buy somebody else's program and just get examples of how other people do strength training and like kind of iterate through that on your own body because that will also help you figure things out. Yeah, if you want to go into this, that would be awesome. I wish I could go back and tell myself about doing it now more to like signal to other PTs that like I am this type of physical therapist.
Okay.
Who also does strength training, but yeah, it's good stuff. My sister has hers.
Sweet.
Yeah.
Me and her are gonna do a
study
a
together.
rotation in Austin with Austin FC, the
Okay.
soccer team. So
That's cool.
that's gonna be later down the road. So I'm trying to see if I can get that certification before
Yeah.
I'm doing. So
Yeah, that'd be awesome.
I just wanted to get your recommendation on that.
Yeah, for sure. It's good stuff to learn.
Thank you.
Yeah, you're welcome.
Later, guys.
Hi. Yeah. So, I'm personal training champion right now, and
Nice.
what I'm trying to figure out with I work with gymnasts, a lot of gymnasts, and
Is that your background too?
I'm a dancer. They just somehow found me.
Yeah.
She adapts quickly.
Yes.
Wow.
But the trouble that I'm having is they have a lot of tissue restrictions, especially with the back, hamstrings, quads, all of that.
Yeah.
And a lot of them have issues with like tightness in their Achilles, and then as well as in the front with the joint Achilles. And so of course when I like am massaging their calves, I'm like constantly trying to spend on that because they're utilizing it for like 6 hours a day.
For sure.
Right. So I'm like, how like
What's the
their
balance
flexion is
here?
already so limited, and like, is it worth spending on the calves? And I guess any client, like, how do I decipher is that soft tissue due to or for the injury?
Yeah, that's a really good question, a really good point about like certain sports that just like really emphasize the calves. It's the like similar correlation that I could make is like cycling is really hard on people's necks because of like being in this position.
Yeah.
And there's certain taxes that I talk to people about like paying, and one of the bike taxes is like getting into your own suboccipitals. If these like gymnasts are having trouble around their like lower leg come up, and you think that it is partially related to calf restrictions, like having them work on that at home with the lacrosse ball is like a super helpful thing. In terms of like other things that can help like balance that out a little bit, honestly, like even working on some stuff that like integrates the hamstring with the calf, like with that foam roller bridge, it seems weird that would be helpful, but a lot of times just like teaching somebody how to help spread that like muscle force up their leg and like over more area, like can be a helpful thing. But it can be tough to differentiate like why is their dorsiflexion limited? Is it like a joint restriction, a soft tissue restriction? Because it's probably both, right? Like the calves are kind of overdeveloped. The other interesting thing that happens with people's calves being overdeveloped is that like does shift their center of mass like forward a little bit, and gymnastics already really promotes like back extension, and like when we hit shift forward, the back extensions are like, it's me, I've got this. For people like that, a lot of the like PRI posture restoration exercises that like I showed you literally one, there's like a zillion of them. A lot of them like are designed to help people move from this state into a more like stacked position. Not because like a gymnast needs to be that way all the time, like their sport demands this, they have to do this, but it's like if you wear out this pattern and like your back hurts and your hip hurts and your everything else is kind of funky, it can help your body at the end of gymnastics practice to do an exercise like that to kind of like shift back into like normal human rotation, rest, digest kind of mode instead of just being stuck like this all the time. So like 99 hip lift is a super basic exercise that like asks for that to happen at like a relatively like low level, and can be something that like isn't insanely hard to teach. Could be helpful. Other things that just like emphasize people like finding more weights in their heels like can be helpful. So even like the kickstand hinge that I mentioned, where like instead of having somebody on the ball of their foot, having them find their heel and moving into and out of that kind of motion is something else that like could be helpful. Like core work that also like emphasizes again rib cage stacked over the pelvis. It's like also evergreen for those folks. So like getting them into like a honestly like a knee plank kind of like position, and then if they might want to be like this, and trying to find might already do some of that, trying to find the balance of like tension on the front side of the body with the back side of the body both working together versus like the back kind of over.
Right.
Is that enough to kick off some other things to be helpful?
Yeah, no, it is helpful.
Cool. Awesome. The other thing besides just getting into the calf soft tissue wise, it's like a lot of time if the calf is restricted, the like the midfoot itself gets like really restricted. So it's like even something as simple as like golf ball rolling the bottom of the foot can like help that like chain to, or lacrosse ball rolling the bottom of the foot can like help out. There's like a whole category of like foot midfoot improvement type of exercises that like important, but like, yeah, of course I would put them at the end. I will make sure that next year if I get invited back that I will do that. Okay, here's one regress version of hopping that I really like. It's called a wall pogo. It starts in roughly that same 90-90 like setup. And like what's gonna happen is Anthony's doing like a reach here. Reaching can help you feel like more side abs. You don't necessarily have to do the reach. What I would start out with is like having somebody with like both legs on the wall. I would have them like dig down through your heels the same way that we just did, and then from there I would have them lift one of their feet. After one of their feet is lifted off, I would have them like drive through the ball of their foot to get their heel up to do a heel raise from this position. Then I would have them hop from this position. This is like the most regressed version for somebody who is super duper sensitive. You don't necessarily have to start the most regressed version. I just want to show you what the like lowest level like would be for someone who is like sensitive to like hopping, where then Anthony's going to kind of show a version where instead of just hitting the same spot, he hops around a little bit.
Would you do the double leg or even?
Yeah, if you wanted to regress even more, you could do the double leg. So if somebody's super sensitive, we're nervous about it, this is what we're going to do, and I would have them practice finding that tension with like the heel raise on the wall with the pelvis scooped up before you go into all of that. If you're not worried about them being that sensitive, but you're worried about them being a little bit sensitive, a banded pogo is a really great exercise. So like looping a band over something high overhead. The thicker the band, you know, the more offloading it's going to do. But ZB essentially going to pull down here and then hop. This honestly is super fun. It makes you feel like you're bouncing on a balloon. But like, yeah, I would start out with a double leg pogo, and if I were scared that a double leg pogo over ground was maybe going to be sketchy, or if I just wanted to make it more fun so that somebody has a really positive experience, like doing the banded pull down thing would be where I would start. I have some kind of like specific cues that I like after I've like watched somebody hop, and typically I'll watch somebody hop like double leg and then single leg first if I think they're up for it to gauge where they're at. A lot of the time it's like the side that somebody's had problems with, they just lost their springiness and they don't hop quite well on that side, so it'd be really helpful for somebody to actually see that in the mirror and be like, we need to work on your springs on your right side. And then be like, that's why I'm having trouble running. I don't have my springs on my right side. It's like, well, it's other things too. But also, yeah, you need your springs on your right side. Your springs are going to come back unless you actually like practice hopping. So from there, if somebody does have a big deficit right side to left side, I have them practice like double leg hops with the band. I have them practice single leg hops with the band. I have them practice double leg hops without the band. And like, there's two main types of pogos that I like to introduce people to at first. I tend to do a pogo first, which just moves through the ankle, so like knees and hips mostly stay still, and it's just feet kind of going like that. That it kind of propels us to space. I really like the cue of if I think the person's down for another cue of like right before your feet hit the ground, bring your toes up towards your nose. That just like tensions the back of the leg a little more. Y'all should try that. So like in a regular kind of hop, we're not really thinking about anything. We're just going. It's a little bit more tippy toes. That's totally fine. But if I want to teach somebody how to strike the ground with a little bit more tension in their lower leg and get ready to create more force, what you're going to think about right before your foot hits the ground, I want the ball of your foot to hit the ground. I want you to bring your toes up towards your nose. Looks like this. It's a little bit louder. Yeah. So what's the difference between this and like a flap? This and like a regular hop?
No, some people don't say like land like.
Oh, foot all the way down. Yeah. Correct. If your heels end up hitting the ground as you're hopping, you are losing some of that like tension. You're not kind of like practicing tensioning through that whole chain and through the like Achilles tendon as much. I tend to like, if we're practicing hopping and I'm really trying to like load all of this up, I'm gonna like not let somebody's heels hit the ground as we're like practicing, at least for like this ankle like kind of pogo. The other type of hop that I like, so that's a ankle pogo. The other type of hop I like is a sinky hop, which is essentially a version of a squat drum. So instead of now the ankle doing most of the work, the knees and the hips are going to do more work to help kind of absorb that. You can have people use their arms. You can also go like arms on hips, depending on like how much you want their arms to help and how much you think that's a good idea. But a sinky hop, similar. And I want the shins going forward. We're still landing on mostly balls of feet. If the heels kiss the ground here, I'm a little bit more okay with that. But the big thing I want to see is like, do the shins actually get forward over the toes? Because if we're always landing with our like knees kind of like back behind, we're not loading the quads well enough, and we're not loading the front of the knee well enough to like actually prepare somebody to get like all the way back to sport, essentially. Does that make sense? And I tend to do double leg ankle pogo, single leg ankle pogo, double leg like sinky hop, double leg or single leg sinky hop. After like somebody's through all of that, and we're not doing hops for like higher distance at first. We're just hopping. We're just trying to get some movement in. Those are called extensive plyos, so we're doing a lot of them over a short time. Intensive plyos are what you go on to next. So intensive means like I'm now going for height, I'm going for distance, I'm bringing some more intensity. I can't do these for like a minute because I'm gonna fatigue out faster than like what a minute would be. And kind of like grading people up from that. From there, you've got like a ton of options where like you can do like a 4-way hop where you like drift forward, drift backward, drift side to side. You can do hops for distance. You can do lateral hopping. But like almost everybody before we do a ton more hopping gets like pogo, sinky, double leg, single leg, and maybe banded.
How long do you do that for? Like, how long should they be able to do that for before you progress?
Yeah. In what I tell people to do, okay, like let's say we did the double leg hops, it looked pretty good. Your body was like chill with it, like in session. I think that we should start doing this because maybe you're trying to get back into hopping. Maybe it's because like I want to get you back to running, but like I'm worried about sending you out on a run, or I think that like you're not really gonna vibe with doing 1 minute on, 1 minute off for like 5 minutes because I think you're gonna think that's boring. So instead, I'm gonna say, hey, we're gonna wait on getting back to running for a little bit. We're gonna do some hopping first. You looked pretty good with double leg hops. Your single leg hops like weren't as good as what I wanted. Your like right side, the side that's been involved here. We need to work on your springs, you know, so we're gonna do some of that. What you're gonna do is you're gonna do double leg hops, and I want you to really have some intention every time you strike the ground. So really get those toes up, really strike the ground really well. You're gonna go until your form starts to break. And generally in clinic, I've gone until like they start to get tired and until their form starts to break, and then I've told them like, hey, this is what it looks like and feels like when your form starts to break. Cool, like great, you're not moving quite as well, or like your height is decreased. For some people at first, that might just be like 15 seconds. For other people, it might be 30 seconds or a minute. Typically, if somebody can hop continuously for a minute and like they're not losing height, it's no problem. I feel like very good about them going to single leg. I will probably not wait to start single leg. What I would tell them, if there's a really big difference between like one side and the other, the side that is like having, if the right side's having trouble, I would have them use the like band and I would have them pull down to like offload their body weight a little bit. And I would tell them like use this as much as you need so that you can feel like you're actually getting off the ground because it can be pretty frustrating to be like, I have no springs, this like sucks. But like, again, go to like fatigue or go until form breaks, take a break, at least a minute break, go do your other exercise that I've told you to do, and I want like 3 rounds to like form break or to like you getting tired, essentially. Does that make sense? Yeah. And then like, I also remind people that like if you go from doing nothing to like a ton of something, you increase your injury risk. So it's like, hey, the first time that we hop, the more sensitive somebody is, the more conservative I am. Or it's like, hey, the first time that we hop, we're gonna dose you pretty good in clinic. I'm gonna watch you hop around for like a few minutes total, and then I'm gonna send you home. You're not gonna hop, you're not gonna run, you're gonna give it a day. If like today's Monday, Tuesday, you're not gonna do any of this hopping, you're gonna do your other stuff. On Wednesday, if you're feeling pretty good and you felt pretty good on Tuesday, you're not sore, things are fine. I want you to increase the hopping like a little bit. So if you did like 30 seconds for 3 times in the clinic, I want you to try to go for a little bit longer, see if like you can push that out a little bit more. Or if you like were already at form break at 30 seconds, things were pretty good, add in like a round of single leg hopping to like what you're doing. And like, you know, if somebody's not super sensitive, you can go up a little bit higher and see like, okay, if we hit the boundary of your body being like, that was the capacity I had for right now, cool. But if not, like, you know, go for it. Where it's like, typically if somebody can do hopping for like 5 minutes with breaks, then like there's a decent chance that like when you try to get them to return to run that it's gonna go pretty well, especially if you do 1 minute on, 1 minute off for maybe like 10 times or 12 times, just because they've already practiced hopping for chunks of time already, which is part of what running is.
So if you do like, if they look good and they don't break one and everything for like a minute, they probably progress to like the next level.
Yeah. Mm-hmm.
And when you refer to the springs, is that mostly like calf power development, or is there other structures that are the springs?
It's mostly the calf and the like Achilles tendon. There is some like, the Achilles tendon has a like, when we do more hopping work, our tendons become stiffer. That stiffness is actually a good thing in terms of like power production. But yeah, in terms of like what I'm looking at when I visually see, it's like okay, we move well on one side, the other side, ooh, that's different, or ooh, your feet, like your heels barely get off the ground.
Right.
But it would, for the ankle version, that would mostly be the calf. If you're doing the CP version, that would then be kind of like whole chain.
Whole chain.
Yeah.
Okay. Okay. So that indicates kind of muscle weakness to an extent.
Muscle weakness, or like, yeah, just like decreased like motor control, like not being able to get a like strong contraction, because it's very possible for somebody like that to like be able to do like a bunch of good heel raises, but then when you go to like dynamically ask the calf to do its thing, there can still be like a deficit, just depending on like, you know, how somebody's tendons are and like where things are at.
Okay, so if they're in that between phase, if they can do a calf raise, but then like the single leg is kind of like iffy.
Not great.
Yeah, you would just do like 2 leg then from there, and then
Double leg and offloaded single leg.
okay, yeah, okay.
We're like, yeah, because if like if they truly like can't hop, it's like
Right.
so frustrating. They're not gonna like want to do it, and it's not gonna be good. So like do the offloaded version either on the wall or like with the band to like help them feel successful, start things off, and like